Right. My apologies for the delay in getting started. We have new technology, which hopefully we will all master by the end of the meeting. So welcome everybody to this morning's meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny Panel. I would normally go around and invite everybody to introduce themselves, so I don't see why I should change my habit, so I will do. My name's Dina Romero. I am the chair of this panel and a councillor for Southdown. Liz.
Hi, I'm Liz Hardman. I'm Baines Councillor for Porton and I'm Vice Chair of this committee.
Good morning, everyone. My name is Mark Durnford. I'm the Democratic Services Officer for the panel. Thank you.
David Harding, Councillor for the Chew Valley Ward.
Councillor Paul Crossley, Southdown.
Councillor Joanna Wright, Lambridge.
Councillor Alex Beaumont, Keynsham North.
Good morning, I'm Ruth Malloy. I'm one of the Western Ward councillors.
Robin Moss, Councillor for Westfield, substituting for Leslie Mansell.
Kevin and then Chris.
Good morning, Kevin Burnett, representing professional associations, NEHT, a co-opted member and non-voting member.
Christopher Batten, National Education Union representative, non-voting.
Thank you. And then starting with Paul.
I'm Paul May. I'm the lead member for Children's Services and the councillor for Pensford and Whitchurch Village.
Chris Wilford, Director of Education and Safeguarding.
Morning everyone, Amy McCullough. I'm a consultant in public health in the public health team at Baines Council.
Thank you. And I think Eleanor's here as a observer and... Eleanor, do you want to... Okay, can you hear me now?
Yeah.
Would you like to say who you are and why you're here?
Well, I'm here because I'm very interested in the subject and just want to keep an eye on what you're all doing. And I had hoped you would have the select advisory councils for religious education's annual report on the agenda.
Well, we can pick that up when we get to the Cabinet Members' report, can't we? So thank you, Eleanor. But I wanted to just clarify that you are not a member of the panel. No, thank you. Okay, so I'm now going to turn to Mark to tell us what to do if there is an emergency.
Great, thank you, Chair. So, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, we follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant. There is an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated a safe refuge where persons needing assistance should assemble.
Thank you very much, Mark. And moving on to apologies for absence and substitutions.
Yes, sure. So we have apologies from Councillors Mansell and O'Doherty, and as Councillor Moss said, he is substituting for Councillor Mansell.
And there's no other apologies or that we need to be aware of?
Oh, sorry. Well, just to say that on the item 9, you would normally have a representative from the ICB. They're not able to attend today.
Thank you very much. Okay, so the next item is declarations of interest. Are there any declarations that need to be made at this point? Okay. Thank you. Urgent business, as agreed by myself. So just as a matter for the record, in our pre-meeting we had an update from Kevin on how would we like to refer to this?
Just we've had a briefing update from
Kevin. That was fed through from the MAC chair, the chief executive chair, and we've updated fed through to the cabinet member and director.
Thank you. Okay, so yes, we've had an update from Kevin Burnett that was directed at the cabinet member and to Chris, the director, as well. And this report was from the MAT chair, and I believe there'll be some action following this. So, and then my other item I wanted to update the panel on is the ongoing work of the knife crime task group. So it's just a very brief report to say that the group has met with public health and also with the police as well, and we have a number of meetings that we are that are in the pipeline too, and as I'm sure you will be aware, there are ongoing cases, so I think it would be probably more beneficial to just give you that as the smallest of updates. So, thank you. Now we move on to the public and councillor statements and questions. Joanna.
Thank you. I've received an email from a resident, Fiona Bell, just pulling it up. It says, how can the scrutiny panel assist with the transferring the management of the Curo allotments to interested active organisations so these green spaces can be put back to the use for which they were intended by people on the long waiting list for allotments and contribute to the well-being of Baines adults and children?
Thank you, Joanna. So I believe this is probably a cross-cutting item, so I'm just going to ask for a little bit of advice on how we should proceed with this. Kerry.
Thank you, Chair. Yeah, we've got a task group currently looking at it's the local food growing strategy, and included within that is allotment provision. That's been a heavy focus of that work. I'll take that question away and feed it through to the chair of the task group. And we meet on Friday, so we'll take that as an action, and any recommendations that come off the back of that we'll obviously report back to this panel to update. And
I believe this panel is about to produce that report, so we should expect that relatively soon. Do we have a date for that?
Yeah, with the meeting on Friday is to discuss the recommendations and conclusions. So we're almost there in terms of our final report. So, but definitely by the May panel, that'll be a public document.
Thank you. And as I know was implied, you know, it is a matter for a number of panels, and therefore it is useful that we will be getting that update as well. Robin and then Joanna.
Thanks. Sorry, addressing Joanna through you, Chair. Your resident might want to get in touch with Westfield Parish Council. About 10, 11 years ago, we handed over the running of allotments to the Westfield Allotment and Gardening Society, WAGS. And that's been very successful for the last decade, ups and downs. But it is a model of good practice, and I'd suggest they might want to get in touch to see how that works. Cheers.
Thank you, Robin. Joanna.
Two further questions. The other question was about local green spaces and the local plan, and how the loss of them is going to impact on public health, and will there be able to bring something to the scrutiny to look at that issue?
Thank you, Joanna. I would suggest this is also another cross-cutting item, so I'm just seeking advice.
Yeah, we've got the local plan options report coming to Climate Emergency Panel on the 21st of March. There'll be a heavy focus there. We've already had representation around the public health implications of the report, so I'll take that away and feed it through to the members and make sure that area is covered off at that meeting.
And we could also ask at our next meeting that the public health representative pick that item up as well. Thank you. And Joanna?
And then finally on school streets, the impact on children and public health of school streets and the lack of school streets presently within the Baines CRSTS programme.
As we don't like lots of acronyms, would you like to...
These regional sustainable transport... I'm trying to remember what the S is for. Settlement. Thank you.
Thank you, Joanna. Always very helpful. Again, another cross-cutting item, which I know has already been brought to the attention of the other relevant panel, but I would just ask Kerry just to fill in any extra detail there.
Just to say that the chairs of this panel and the climate emergency panel are discussing about how best to take that forward as a scrutiny item and add it to a forward plan. So once we've worked that through, we'll update panel and include it within our forward plan.
Thank you. And it might be an item that, of course, the Cabinet member might have some more information on, because I believe it was from the discussion that happened in our budget meeting, that school streets was definitely referred to at that moment as well. So I'm sure Paul will be able to give us some update when it comes to his item, which is very soon. Thank you. Okay. Any other questions or any other statements from councillors or from members of the public? Our next item is the minutes from the 5th of February. So, panel, are there any queries or errors on the minutes? David?
Thanks, Chair. Yeah, I made a comment regarding the loss of provision of the dual-use leisure centre facilities at Chew Valley School, and that's not minuted.
This is an omission, then. It ought to have been minuted. Will you minute that and amend the minutes? Thank you. Any other points from you, David? No? Any other queries or comments?
Other than what we said before, about asking for greater feedback on charter plans.
Okay, of course. And so you might want to bring that up with the Cabinet member.
Okay.
Yes. Yeah. Okay, thank you. Right. In that case, with those corrections, are we happy to approve those minutes? All those in favour? Excellent. Thank you very much. So our next item is the Cabinet members' update, and thank you for circulating that in advance of this meeting, Paul. Is there anything you want to add to that?
Thank you, Chair. Yes, if I can. Can I talk to Councillor Wright after the meeting about the school streets? Because, if I'm honest, I don't really know an answer to her question. So if I can understand the question better, I'll deal with that separately. Thank you, Chair. On the other issue, just not in my report, but it came through late last week, was a decision by the Department for Education around the alternative provision site, which is something we've been waiting for and been pushing for months. In fact, ever since I arrived, it was the first thing that was being discussed. So it's really good news for the authority, and I think great credit to the officers that they've just kept the pressure on the DFE to get a decision for us. It's also linked in very carefully, I think, to the safety valve, which I gave a commitment at the last meeting that we would do a full report. I think it'd probably be the next meeting because there's a timescale issue, but Chris really does think that we should be a bit more open and have scrutiny of safety valves so that the advantages, which are considerable, but we also know what the risks are, which I think that's important. I think then, just going through the report, the one issue that I would perhaps highlight a little bit more is around the budget, because there's been a lot of talk in the Council about the £802,000, which was the adult budget, which would directly affect the community sector. But there was also 300,000, which was in the children's budget, which was split between public health and education and children's services. And I'm pleased to say that I don't know whether I was going to say backing off, but the fact that the Cabinet member actually did listen and said that we would be able to do the review properly and correctly. It's a bit more complicated in children's services because it was both a mixture of the voluntary sector and our own provision. But as I've put in the report there, it's targeting the early intervention, which is directly contrary to what I would want or I would think the committee would want. So I'm pleased to say that Mandy Bishop, who's the Director of Operations, has said that she's going to work with Alison Bourne and myself in having a programme board to actually work this through so that we are working effectively with the voluntary sector and officers to make sure that we're actually doing this in a fair and proper way. The voluntary sector quite rightly said that they think that with the 40-odd that are in the HCRG contract, that there will be some savings possible, but what we've got to make sure is that we're working effectively with the voluntary sector, not telling them what we're going to do. So I think it's a major change, and I'm really pleased that that is going through the next stages. We've got an item on the the council meeting on Thursday about care experienced young people. And I'm not certain, I'm looking to my right, whether we've actually agreed the wording yet, but there's been an instruction that we should be getting the wording agreed from both parties, and I think there's a lot of agreement in the council. It would be really, really daft of us if we get to the council meeting and there's not a full support for that. I sent a note out to everybody around our corporate parents meeting, which is, I think, tomorrow, which I was perhaps a little bit pushy on that, and I apologise, but it is important because we tend to see the same councillors turn up to corporate parents, which is really great, but there is a need, I think, for us to get the message over to all councillors that even if they can't get along to every meeting, that they do at least try to get to one meeting a year. And I've also made reference to the fact that Mark Liddell, who's a national lead for corporate parents and the way that local authorities should be dealing with that, is going to be invited along to one of our meetings. And he really is inspirational, and it is something that the local authority is now actually judged by Ofsted on separately, and if we're not doing that effectively, then that could affect our overall Ofsted rating. So it is important, both in terms of the local authority, but more importantly in terms of the children that we care for, and that's really important. I think apart from that, I mentioned about the community summit, which was a bit of a shock to me. It was organised jointly with the University of Bath, and I was really surprised. I was asked to speak at it, but I was shocked at the number of people there. There were approximately 200 people actually giving that commitment to young people within the area, because it was focused on Bath and North East Somerset. And it was interesting the number of people that were there talking during the day. It was a very, very full day, and I think it was a sign of the commitment there is by the community to young people, and particularly vulnerable young people in our community. So I'm sorry I've gone on a bit, Chair. I'm more than happy to take any questions, and if I can't answer them, probably Chris can. Thank you.
Thank you very much. I think Robin was going to come back on whether or not agreement has been reached, I would hope.
Yes, I think we had a conversation on Friday and have to have a conversation after this meeting with some wording. I don't think there's any issue about the principle. I think it's in parts just some of the wording to firm it up. As well, can I just comment? It's an odd way that we've come to where we are. I think I personally would have thought that if we're going to do cross-party, almost non-party stuff, that coming to a scrutiny panel first and then going as a report to council rather than going through the party political motions route, you know, for a thought for future reference, because I'm sure there's some blame in my direction as well. It's been slightly confusing how we've tried to do this, and usually amendments can go into other party resolutions without having to go via officers. And again, I think that's an example of the scrutiny route versus the political route. But I'll have a chat after this. Quite happy to share the wording. I'm sure I'll have it for this evening, and everything will go swimmingly before Thursday, of course.
Thank you, Robin. I think that's a really good point, of course, because we aren't just a scrutiny panel, we are actually policy development and scrutiny. Thank you. Sorry, Paul, were you going to come in?
Yes, thank you. I'm still a new Cabinet member, so I'm learning as we go along. The simple fact is that the motion was drawn up after the corporate parent meeting. I believe it came from a discussion that took place with the Vice Chair of this committee about whether we could and should be moving this. We then took it to the corporate parents meeting and to children in care experienced children. And then we went to, because we're not the only local authority that's doing this, we went to the LGA site, which actually gave a standard motion, which is the one that we actually then produced moving forward. So I'm sorry if we've managed to get this wrong, but the silly thing is the principle is something that we all absolutely agree on, and we've just got to try and make sure we don't fall out over the wording.
Okay, are you going to carry on this conversation, Robin?
Yes, and I've got some points more generally on the report as well.
Okay, that's absolutely fine. Okay.
As I say, I don't think anyone's got it wrong, because if the end result is we get to where we get to, then that's fine. I think the comments were just about maybe the process smoother. The conference that you referred to, is this the 2nd of February one up at the university? Yeah, it was just, I got just checking what role that Baines is going to be playing in that and what resources, if any, we're going to put into that. There's also, I'd remark as well, that the conference agreed to set up a socio-economic observatory to build capacity using current evidence, data infrastructure, exploring gaps in collective knowledge and co-production in research and policy. Not the most accessible of statements, and probably not the most accessible of statements if you want to involve young people, as a suggestion, just suggesting.
I note the comments, Chair. I actually took the wording from the invitation to the event because I didn't understand it that well. So I think it's a perfectly reasonable query. The other element is the resources that we do have staff that are working on this all the time. So it's not anything that's going to be necessarily out of our scope. But I do think what I was impressed about was the fact that the commitment in the community was the major issue to young people in Bath and North East Somerset. And the other thing at the bottom, I meant about the equality work that we're doing with schools. I once again got invited along to a podcast, I think you call it, around race equality that has been a charter that we've been talking about with schools. Several schools have implemented it and done terrific amount of work. And it was really, really encouraging to see the commitment that they've put and how things are changing. But not all schools have agreed. So the element was to actually try and widen the engagement with schools across Bath and North East Somerset.
Thank you, Paul. I think it's also really interesting to hear all these different initiatives being set up and the different conferences. I think the important thing, though, is try to make sure that that everything, that there's no duplication, that that everybody who ought to be involved is involved as well. I'm sure that that was a point that you would have been also pushing for. Any other questions? Okay, lots of hands going up. So I'm going with Kevin, then Ruth, and then Liz.
Thank you, Chair. Yes, Paul, thank you. Just on the point that maybe Dina was making, I wasn't quite clear who actually was behind the summit and what their actual aims were in calling it. I was sort of left a little bit blank as to where it fitted in the wider picture of things, and maybe that fitted in with, is the council behind this, is it just somebody calling a meeting, or why is it being called, who called it, and what do they intend to do about it?
Sorry, which item are you referring to?
The university summit. I'm still a bit lost as to who called it and why they called it.
I believe it was driven by our colleagues at the St John's Foundation, who are working with some of the intelligence team in the council, some of the public health colleagues, and with some of the voluntary sector organisations in relation to some of the outcomes of children and young people in the local area. Personally, wasn't involved in the development or the setting up or the running of that conference, but really pleased to hear some of the outcomes. Some of my staff did attend. That's come from it. I believe it's a wider piece of work where St John's have been looking at through their strategy about how they can be involved and support improve some of the outcomes for children aged 0 to 11.
Thank you, Chris. And I know that certainly on a later item on education performance, I would expect to hear a little bit more about the work that St John's are doing at that point as well. Kevin.
So is there actual, Chris, from what you said, is there actual outcomes to do with education from that? Because obviously it's not here, but it'd be useful to know where it came from or what actually is going to happen next. Because again, we're looking at, as you mentioned, St John's Foundation and the work with the disadvantaged in schools and the pilot projects they're doing, but I just want to try and make the connections.
Yeah, I'll have to find those questions out and come back to you on that, Kevin. I wasn't involved in the design setup or even the invites in relation to the conference itself. So I will need to get I'll have to have those conversations and feed that back to the panel.
Thank you.
Via Mark.
Chair, can I have a small question, please, to Paul? And Paul, can I just ask, on the savings you were mentioning, so has anything actually around early help, has anything actually decision being made on that, or is it still being worked through? I wasn't quite sure whether you meant that you're still working with people on the savings, or whether you've now decided where the savings are going to come.
The simple thing is, it's up in the air, but it's not a fait accompli, because quite clearly, Councillor Elliott said that if there's going to be a saving made and that then increases the long-term costs, then we won't be pushing it. So the simple fact is that if you cut early intervention, the implications are you're going to get more children coming into care at a later stage. So having got that commitment from the Cabinet member, we're going to be using that as the basis of our discussions around children's services. Because, you know, if you're talking about supporting families or you're talking about the Youth Connect service, those are really early intervention schemes which are that important. I appreciate that the council has to have a balanced budget, but the simple fact is some of those issues are quite difficult for me in the same way as they are in adult services and housing. You know, those issues we've got to really think through very, very carefully. But the really good news has come out of this process is that the voluntary sector have said very clearly they want to work with us, and they are working with us. And why we were so upset, I think, was the fact that it was an imposed last-minute cut, which we hadn't been that consulted over, and we now need to actually do the exercise properly and correctly moving forward, and we will be doing that with the sector.
And thank you, Paul. And I think we are all... actually, can you turn your microphone off? Because I think... Is that better? Yeah, I think you can... there is a conflict, isn't there, with two microphones on. I think we would all agree that prevention would be, where we would want to put the focus. And I think we are grateful for the words of the Cabinet Member for Resources on his commitment to ensuring that every one of those services will be properly assessed. Can I ask you to ensure that this panel is kept informed of what is going on, rather than we are suddenly, presented with a fait accompli?
Chair, I'd be delighted to, because I think it is important that we actually, and the reason I put about the budget after the budget was I think the intervention for this committee was really, really important. And it helped us in those discussions we were having in the closed rooms, if you like, around informal cabinet. So I'd be only too pleased to keep you informed as we go forward on that.
Because I think there's also, there's a monetary implication as well, isn't there? That, I think, and I don't know if it's absolutely the same for children's services, but there is an assumption that £1 spent in preventative services from will actually save around about £20 in the future. So it's a benefit to do it, isn't it?
Even the government has said that they sent a note out about supporting families late last year, and they said that every £1 spent on early intervention would save £4. I think Sheffield University had indicated there was £8 saving, but whether we're arguing about the amount of saving, it really is important that we don't actually lose sight of the fact that a cut there would be really harmful to the most vulnerable in our community. And I'll keep fighting it, Chair.
Thank you very much, Paul. We are all very grateful, as indeed I'm sure residents in Bath and North East Somerset will be too. Ruth.
Thank you. I wanted to say I'm very pleased about your suggestion of inviting Mark Riddell, I'm not sure how to say it, National Advisor for Care Leavers, to come. I assume you mean here come to one of the corporate parenting group meetings. However, I was wondering, is there a precedence for inviting somebody like that to come and speak to full council? Because then you will be more likely to have a large number of members present. And I agree with you. We do overall. We need to encourage more councillors to come to the corporate parenting meetings. But sorry, can you hear me? So so that's my question really. I don't know who can answer it for me. Is that a possibility to invite him to full council, so immediately before it, perhaps? Anyway, thank you.
Sorry, Ruth, we're just double-checking something, because it might not actually be within our constitution to allow somebody from a national organisation to do exactly that, to address full council. But, I think the first step of addressing the corporate parenting is, absolutely, a good way forward. But Kerry's going to double-check the constitution.
Yes, because that would be interesting to know, because that's a good way of making sure you've got
nearly
all of the councillors in the room.
Well, it's not just because they're councillors, but because every single councillor is a corporate parent. And that's the important part, isn't it? Robin.
Just following on that, I think Ruth's point about before a council meeting, we've had that in the past with some briefing sessions where you have it at 5:30 or 6 o'clock, so it doesn't interfere with the constitution, and it's always good to have the sublime before the ridiculous.
I don't think we should comment on your thoughts about full council. But thank you, Ruth. I think that's a really good suggestion, and as soon as we have the answer, we'll come back to you on that. So, Liz, you had some questions. Sorry, Ruth, have you finished your questions? Liz.
Okay, thank you. Thank you, Chair. At our last meeting, we were very concerned about the closure of Charlton House, and we asked for further updates. So, Paul, as the Cabinet Member, I think we would ask you to bring this to next Cabinet meeting, and perhaps it would come back to our panel here, that we would like an update on the process for closing the final ward at Charlton House. and the negotiations and preparations for Charlton House becoming a residential home for children with special, very complex needs. Also, we were told that no consultation has taken place about redundancies until after the Cabinet decision was taken to close Charlton House. So we'd like some information on that, and also an equalities impact assessment. So we decided at our pre-meeting that this would be something we would ask you, as Cabinet member, you share this panel with Alison Bourne, that we would get feedback next time round. I think that's clear.
Yes, I think so. Yes. So we wanted to make sure that we were privy to sort of information and consultation as it happened, so that again we were not presented with an end result, that we were kept abreast of everything that was happening, because it's a multi-staged process, isn't it?
Fair comment, Chair. I'm just aware that you said the next meeting, which is, if you like, the adult version. I'll make sure that I talk to Councillor Bourne to try and pick that up, because we've got to go stage at a time. But I'll try and make sure that in the subsequent meeting we pick it up in our report.
Thank you. And Chris, you wanted to come in as well.
Yeah, just to say, picking up Liz's point about, I was at the last meeting. There was a request for more information about the residential school timescales, consultation as well. So we'll make sure that we've got that inputted into Alison's report for the next scrutiny as well.
Final question, Paul. I'm really pleased to hear that the £300,000 cut, which I was going to ask about and drill down deeply into finding out exactly where it was going to happen, is obviously not going to happen, or is going to happen in a way that will protect our services for young people. But looking at our young people and free school meals, this panel has always pushed very hard as part of our policy development to make sure that children or young people in receipt of free school meals will get free school meal vouchers during the holidays. Now, I know we have set £80,000 towards this to last up to and including Easter, but do you know what's going to happen after Easter? Will the half-term holiday in May and summer holidays be protected? Will we have free school meal vouchers for our young people during those holiday periods?
Yes, I think when I spoke to Mary about this, and the thought was that the government might actually, this side of an election, carry on with the funding. But I haven't actually seen anything to confirm or deny that. So I think it's a fair question, Chair, and I think we need to go away and actually just make sure what the situation is. Because I think it hasn't been extended as far as I know, but I do need to check on that.
I was under the impression, actually, sorry to butt in, that they had been continued at least for a certain number of months, and I understood that our holiday school meals was actually coming out of that, so that might give you kind of like a steer.
As I say, I just don't know. So, I think it's a reasonable query, and it's something I'll have to come back on, if you don't mind. And I'll do it to you, Chair, and to the Vice Chair. And if other members want to know, then I'll make sure it's circulated to the whole committee.
Well, if you send it to myself and to Liz and to Kerry, and then Kerry can make sure that everyone is informed. Thank you. So just coming back to the point Ruth was making about whether Mark Rydell could speak to the whole council, just having a quick perusal of our constitution, it suggests that that would not be appropriate, because there's a lot of focus on Bath and North East Somerset residents and organisations, that they have a right to speak rather than a national body, and it would be, from, as I said, very quick perusal, it seems that it would be very difficult for his role to be sort of neatly fitted in to that sort of criteria. But as I suggested, definitely we will have him come to speak to the corporate parenting group, and we can find another way, I'm sure, of putting his thoughts and comments to a wider group of councillors. Ruth?
Yeah, I thought that might be the case, but perhaps, you know, if it has been done before, maybe there's a possibility to have a short meeting prior to the full council meeting, because members will be coming in for that anyway. But I don't know about the logistics of it. It's just that I think it's a good opportunity. It would be a good opportunity to you know, reach as many members.
I think what we'll do is we'll try and find a way of taking the sense of what you want to do forward. Okay, thank you. Any other questions? Chris?
Yeah, I just did a quick check on the free schools meals vouchers, which are paid from the Housing Support Fund. So that was extended in the budget for a further 6 months. So we did do some clarification with our welfare team, but I would expect we would continue with the provision through that. That obviously would take us across an election period. Yeah, it feels like it's constantly been temporarily extended, but it isn't as yet an ongoing regular thing. But I would expect the May and the summer holidays to be supported, as there have been each time the fund has been extended in Baines.
Thank you, Chris.
My apologies. I should have referred to the Housing Support Fund and not the Holiday Activity Fund. Yes, that's always the danger of an acronym, isn't it? Okay. Any other questions for the Cabinet member at this point? I just wanted to pick up on one item, Paul, which actually I think could easily fit into one of our other items on the agenda. So if you wish to, might give you a moment to think about your response. So you spoke about the alternative provision. I know that we have had for some time a need for additional send provision, and I just wondered if you could give us any update on how that is working out. I think originally we were looking at a potential new school in Keynsham, and yeah, just be interested in your thoughts about how that process is working.
Chair, you kindly mentioned this to me on Friday, so I asked Chris if he could give an answer on this one, please.
Thank you, Paul. Yeah, as you know, so we are now in the fortunate position in Baines of being successful in 2 applications for 3 schools in Baines. The free school for SEND, which we had announced before Christmas, in fact some time ago, which is one that you're asking about. We're still looking to find a permanent site for the school. Our search in Keynsham has not been successful. We are looking at whether it would fit on the Culverhay site alongside the AP free school, but which is a decision's not finally reached on yet, I believe. But that would work really well in terms of timeliness, because the drive for me is urgency. We really need those spaces for children with special educational needs, and we need that AP school. Potentially that site would enable for those schools to be delivered quickly. But there's still more work to do with our free school team. As you know, the local authority is not responsible for these builds, but we are working closely with the free school team, and we need to deliver those projects as quickly as we can. It relates to other SEN projects. There's obviously the conversation about the residential school you've asked for an update on, which you can bring next time. We've also got up to 8 resource spaces we're looking to develop across the whole of Baines, which is going to be part of our safety valve work, and as Paul mentioned, we'll bring a report back there. A resource space is additional space in the mainstream school, either at primary or secondary, to support children with special educational needs, and is often very popular with parents, and it's projects that we want to support. Those 8 resource spaces should be built between now and in 2 years' time. Some of them are projects which are easier to deliver, depending if the school has already has the facilities which we can use, or whether we need to build new facilities. And I can bring information on those 8 resource bases back here in Baines to the next panel. That's not a problem.
Thank you. I think that would be of interest, and I would hope also that you're keeping potential providers are updated, because I think what you have said is slightly different to a conversation that I'd had with one of our specialist providers. Okay. Any other questions for the Cabinet member? Right. In that case, then, I am moving on to the next item, and I'm aware that we don't have anybody to speak on this item. So I don't know, Paul, if you wanted to give any updates on the Integrated Care Board work.
No, sorry, Chair.
That's okay. So are there any questions that we want to be forwarded on to, I would suggest Laura Ambler in the first instance, bearing in mind we won't expect to have an answer today. Okay. Robin and then Kevin.
Thank you. It was just picking up an issue on the dental recovery plan update. And if you'd like, I'd like to stress the urgency of that. I know it's anecdotal, but there's an instance, is that the right way to put it at the moment, of a Ukrainian refugee who needed urgent dental treatment, tried to access it in the UK and found that she couldn't afford it. So she had to fly to Poland. She crossed over the border and is currently in Lviv, in the west of a war zone, to get treatment that she can afford. And I think the comment is that the dental service in the UK, and clearly Baines is such a state, that people have to go to war zones to get their teeth done, rather than being able to do that in the UK. Absolute disgrace.
Thank you, Robin. And that's not the first example of that I've heard either. Liz. Kevin, and then Joanna, and then Liz.
Thank you, Chair. There were two questions, please. One arising from the updates that came to us, which was around the pharmacies and their role. And just concerned that, again, she did stress, Laura, the last time about communication systems, and that if we're not careful, people are going to be lost between lots of different places when they go and get help, because it's the only thing they can do at the time. And we're losing that single point of contact around the NHS, where one person overall sees what's happening with that patient and with that person. And it's getting a little bit concerning, but just where she's at with that, and whether she can assure us that that is not going to be the case. And the second thing, which was a question I raised a little while ago, was to ask Laura if she could actually explain what the role of the SEND representative is on the ICB, and exactly what they do and which committees they're involved with, because it'd be useful to know what, if anything, they do, or are they just a receiving point of information for SEND?
Two very good points. I don't know whether or not, Chris, you'll be able to give any explanation about that second point, about the role of the SEND representative on ICB?
Not in terms of specifics and the details, but I know that obviously Baines and Wiltshire now is combined under that footprint, and there's been a real drive from the DCS's, Directors of Children's Services, in all three of those areas to make SEND a real priority, and to make sure that they're joining up some of the best practice across the three areas, so that we can work more closely. So we were pleased to see that as an outcome, but I can't tell you the absolute specifics of what they do on a day-to-day.
And
Chair, I asked Mary literally last week about our representation on the ICB. I understand the Chief Executive is on the ICB, the main board, but also Mary is represented on one of the programme boards as well. So we do actually have representation on the ICB, which is not the case in all areas. So I think it's positive in the fact that we're actually working effectively with the ICB. But I think probably we ought to ask the question why Laura's not here today. If she isn't here, is there anybody who can substitute for her? Because, you know, I'm a pretty poor representative for her. But I do think this committee is really important. And I know that we've got adult services and children's services, and it's sometimes a bit difficult for them. But I do think it's important that we actually do have a representative here for the committee meeting.
Thank you, Paul, and I'm sensing there's strong agreement to that suggestion as well. So we'll put that to Laura to make sure that she can't attend, that there is a good substitute.
And I'll take it up as well, Chair.
Thank you. So, Joanna, so I wanted just to say one more thing, actually, just picking up on one of the points that Kevin made, which was about the comm systems. I seem to recall when the Chancellor was speaking, he did make quite a lot of reference to joined up communications between a number of different health, parts of the health system. So perhaps also we could ask Laura to just spell out how that will work in reality, alongside answering Kevin's question as well. Because I think that's always been a bit of a failing within health, that no one part sort of is able to automatically link up with another. Okay, so Joanna, thank you.
Thank you. Again, going back to the NHS Dental Recovery Plan, it says in the document sent £200 million of new funding has been made available to improve access to NHS dental care in England for those that need it most, especially people living in undeserved parts of the country, which will see up to 2.5 million additional appointments, including up to 1.5 million additional treatments in NHS dentistry. What's not clear from that statement is where those undeserved parts of the country are, and is Baines included in that, and how do they organise that? It's quite misleading information, as I would say the NHS Dental Recovery Plan is, because essentially they haven't funded it properly.
Thank you. And then David. David.
Thank you, Chair. Regarding the pharmacy and Pharmacy First, the Pharmacy Union Pharmacists Defence Association surveyed pharmacists. There were 3,500 pharmacists surveyed, and almost half were concerned that they didn't have enough staff to safely deliver Pharmacy First. And I'm wondering how the safety of this programme will be monitored in Baines.
Thank you. A very, very good question. And perhaps a follow-up question also ought to be around how will more staff be found? That feels like it's a question that's asked of pretty much every part of the NHS, doesn't it? Thank you. Liz.
Thank you, Chair. It's back to communications again, and it's looking at drilling down for a bit more detail in that these pharmacies that are offering treatment for the more common conditions, residents in my area certainly don't know about this, and I would hazard a guess that many residents throughout Baines do not realise that some of their chemists that have NHS on it are offering this extra treatment for patients, obviously to speed up their treatment because they're not getting GP appointments. So I think I've asked this before, but we really do need some sort of major communication to go out to let people know. And again, with the prescription ordering direct service, which was in the recent report, again, what publicity have they had? And again, what provision has been made for phone lines for non-app users, because it's very much digital again. And there may well be people who don't have phones with apps. So I think it's a question we need to put to Laura.
Thank you. And also, you know, is it the NHS's role to communicate this, or is it the council's role? You know, where does that responsibility lie? And whoever has the responsibility, can they make sure it goes out in easy to understand language? Thank you. Ruth.
Thank you. Yeah, one more thing I was interested to read in the report from Laura is about the environmental initiatives at the RUH. And maybe I would be interested in having more information about the 5-year sustainable travel strategy that's just been started. Maybe we could have a bit more information here. I see that, recognise that that might be something that is more suitable to go to the Climate Emergency and Sustainability PDS panel. I think they definitely, I would say, probably be interested in that, given that so many people work at the RUH. And as a Western councillor, of course, I'm always interested in what's happening there because it also impacts quite a lot on Western. So I'd like a bit more information about that at some point, if she can give it to us, and a suggestion that maybe a report could go to the other PDS panel. Thank you.
Thank you. Yes, because obviously an item that's on transport would sit within the climate panel. Yes. But as Joanna pointed out earlier, many of these items of interest are cross-cutting items. Okay, right. Any other questions, comments on this report? Just double checking. In that case, then, I would like to move on to the next item, which is the Education Performance Update. And I'm going to invite Councillor May to introduce this. Over to you, Paul.
Thank you, Chair. I think there's two things I want to draw attention to in this report, which is Chris's report, is the issue around free school meals and Key Stage 2. It's not something to be proud of that we're now the worst in the country. That it's really important for us to actually recognise that the overall performance in education is absolutely superb in this area, with high quality education being provided by our schools, or secondary schools in particular, but the issue around free school meals and Key Stage 2 performance is a real issue for us, and you can say it's about the small numbers, but it is an issue that we do need to be working on, and the support that we've been having from St John's, I think, has been something that is bringing young people up to standard by Key Stage 4. But it does bring home the fact that we've got to continue working with the DFE around performance in schools, and we're actually talking to them more effectively, because quite honestly, I've said many times in the past about my belief that when it was the local authority was the education authority, that we were able to deal with many issues in an effective way. Since we've gone to the new regime around multi-academy trusts, that the role of the Department for Education around the quality of what's going on is an issue that has been a worry for me, and I know for many councillors in this council chamber. But the fact that they are talking to Chris, and the School Standards Board is talking to Chris, that there is, I think, in this area, a lot of trust between the schools and the local authority, which is not the case in many, many other areas. And the fact that we now need to be making sure that we work more effectively with the schools. And the Department for Education has been talking to Chris and myself around the concept of an area plan, looking at the needs to see whether we can in actual fact work with the schools, the local authority and the DFE to get greater engagement around, particularly around SEN in schools and the standards in schools moving forward. So I'll hand over to Chris at this stage.
Thank you, Paul. I think Paul's provided a really good summary there in relation to what's in my paper, so job done. Today I was going to go through the slides and the screens, but we're a little bit tech pecked out at the moment, so I'm not going to be able to do that, but I will just summarise the key points, and in the report you can see the slides that I'm referring to. So if you have got the information open, you can have a look at that. But yeah, I just wanted to pick up on a little bit about the context of Baines and education, really, because I think it's really important thinking about the role of the local authority in the arrangements that we have in Baines, with 97% of our schools being academised, and there being a number of multi-academy trusts of different sizes. And then the developing role of the DFE South West Region Group, who oversee the academies, and obviously Ofsted. What we have in Baines now, I guess, is a reasonably complex system around education, of which the local authority is no longer the key driver in terms of oversight of the performance. But we're obviously really interested in the performance of our children at school, and we want to be involved, and I think we still have a really pivotal role to play in the local authority, both in organising activity to be able to look at some where the performance isn't where it shouldn't be, but also be able to challenge and to be able to point out where we think there are areas where we need to improve. And we do that mainly through the School Standards Board, and the South West DFE representatives come to that as well. And tomorrow at Standards Board there will be a local area regional plan of priorities, which the DFE South West have started to develop based on our data and based on some of the information there. So there will be a regional planning process around some of our education gaps in Baines. So just to reassure you, that happens, and we just have to work quite differently. Our role is around influence and challenge and support. Where we do have resources in the local authority, we do focus on some of the gaps which have been mentioned here in the report today. So I have asked some of the other council officers to attend today, either both to help me answer some of your questions, but also to provide some reassurance about the work we do in the local authority. So Julie Eden, who leads our early years service, has come along today, and she'll help with any questions around early years. So in the early years, we still have a lot more influence. We have teams of staff who are working with the sector. We support the sector quite a lot, and Julie does a lot of work in this area, particularly around the Language for Life project, which hopefully I'll get an opportunity to hear a little bit more about today. And the other thing I wanted to just mention today is that we invited Amy McCulloch from the Public Health team to talk about a piece of work that Public Health are going to start to do to look at the wider determinants around that attainment gap, because it's not just about the schools in Baines, there's much more to it than that. So it's just to say my colleagues are here to provide more assurance about the work that we're doing, because I'm really conscious that this is the second time. I've been in my role for 4 years now, and this is the second time that I've come here with a report which I think says pretty much the same thing as it did when I came last time. Having been in Baines for some time, it's a fairly similar picture that I've seen presented in years gone past by previous directors of education in relation to our performance. So I just wanted to try and provide a bit more assurance today with colleagues who attended. So, as I said, I'm not going to go through the slides. You've got those there. What I would encourage you to do is have a look at the strategic evidence base. That's on there through that link. You will see a lot of information, not just about education, but around all sorts of issues in Baines. Education has got a section in there, but you can find also things about the demographics of this local authority, about housing, about climate emergency. And if you hadn't had the opportunity to have a look at that before, please do go in there. It's a really big wealth of information. And I've just lost my page, so I'm just going to open it back up again. And the education section starts on page 108. There's lots of information there about last year's results, which I'll just summarise, but all sorts of information around demographics, school absence, exclusion, things like that. So it's a really good, useful report to look at. So as Paul said, the academic results for 22-23 in Baines, if you look at them from the outside broadly, are fantastic. There's some really, really strong results across the piece. The only area where we're not as strong as we usually are is in Key Stage 2, in terms of we've just dropped below national. However, last year we were way above, and traditionally we are normally way above in terms of results there. So there is an interesting conversation that happened at Standards Board tomorrow around that. But overall, Key Stage 4, Key Stage 5, Baines' results, both in terms of attainment and the GCSEs, which were achieved by our young people, are to be commended, and equally our A-level results as well. I will also say that the quality of schools in Baines, I think, is very good in terms of both the outcomes, but if you look at the Ofsted outcomes and the inspections that are happening in Baines, our data has improved since this information was provided here. All secondary schools in Baines are now good or above. We have no RI schools, secondary schools in Baines. Our 2 remaining RI schools were inspected before Christmas and both achieved good outcomes, as did a couple of our primary schools. So the quality of the schools in Baines is good. So I'll just summarise some of the stuff by the different age groups. So in terms of the early years, 71% of children had a good level of development in Baines. That is higher than the South West and England's averages, and 69% of children in Baines were at the expected level for all 17 early years learning goals, and again that's higher than the South West, so some good performance in the early years. In my report I seem to have missed Key Stage 1 and phonics, but if you look at the slide on slide 115, you'll see that we also perform well in Key Stage 1. We also perform well in across all areas compared to the South West and nationally. So again, that continues to be an area of strong performance for our schools in Baines. As mentioned, when we get to Key Stage 2, our expected standards in reading, writing and maths, while slightly above regional averages, dip below the national averages for the first time. So that's quite an interesting conversation. I think that, as mentioned, we'll have at Standards Board tomorrow. That is normally traditionally quite higher. Key Stage 4, pupils in Baines achieved a higher proportion of grades in maths, 51% compared English and maths compared to the South West at 45% and England 45%. So again, really strong performance in Key Stage 4. And equally in Attainment 8, you can see the same pattern of strong performance against our regional and South West colleagues. Children in Baines also make really good progress between Key Stage 2 and Key Stage 4, with pupils in Baines on average a quarter of a grade higher in each qualification compared to similar pupils across the country. So there is a real strong sort of theme emerging, a pattern emerging about how well our children do when they hit secondary school, which again is something to be commended. So there's a lot to be positive about here in Baines, particularly when we look at some of our regional performance. Again, that's replicated in Key Stage 5 and A levels, which again is above regional and national. However, as I've mentioned before, when we've come here and talked about the reports and performance here, we do have a very persistent and stubborn gap for our children on free schools, particularly this year in Key Stage 2, where it's dropped quite significantly compared to last year. And as you can, Paul mentioned, and it was mentioned at the conference that happened recently, that is one of the worst attainment gaps in the country. And we've also seen a decline in the performance of those children in an early years framework as well. So that's disappointing again to see, but I'm hoping that we can have maybe a little bit of a conversation today where we can provide some reassurance about the work that we're trying to do in Baines around the area. What is positive is that when we get to Key Stage 4 and children sit their final exams in secondary school, that some of our performance for that cohort does come in line with the national average. So those outcomes for those children do improve when we get to secondary, but we are seeing a continued decline in performance in Key Stage 2. Moving on to SEN, so it's a slightly better picture for our children with special educational needs, which is more encouraging. A lot of the outcomes for children, both at Key Stage 2 and Key Stage 4, are in line with national and regional averages, which is positive. Slightly down from last year, where we had the performance of our children with special educational needs and disabilities in Key Stage 2 and Key Stage 4 was slightly higher than average. But that is really positive to see in Baines as well that isn't also dipped down. One of the things you will have picked up, possibly in the news recently, there's been a lot of focus on this, is that attendance has dropped across the country. There's been a rise since the pandemic years in persistent absence, and the South West is one of the areas which has been highlighted by the DfE as being particularly affected. I am pleased to see that Baines is better in terms of its levels of persistent absence than the regional averages and the national averages. However, we are below where we were pre-pandemic. So we are seeing high levels of persistent absence in Baines, which is still lower than the national regional averages, but higher than we were pre-pandemic. And I've got some information I can share with that around that particular issue, should you want to ask further questions about that from my colleagues. In relation to exclusions, we also have some continuing patterns. So whilst in the previous academic year, our permanent exclusion rates were lower than we had seen previously, last year's permanent exclusion rates were higher. We don't have the national and regional information to be able to compare yet. That's not been published. But I can say to you that where we were at the end of last year in terms of permanent exclusions was probably the worst in terms of numbers since 2017. We have some narrative evidence back from some of our South West colleagues to say that last year they also did experience a big rise in permanent exclusions across Baines. I am pleased to say this year that the number of permanent exclusions is going down. We've done some additional work around providing additional support to schools around guidance on exclusions, which is having an impact, which is good. In terms of suspensions, which are what used to be called fixed-term exclusions, in Baines we do have some familiar patterns. So suspensions rates, particularly among our free school meals children and among our black children, are much higher than regional and national averages. And this is a focus of the efforts for some of my teams and some of the work that I do in Baines to work with my voluntary sector colleagues in SARA, Black Families Education Support Groups, and to really drive home the work and support in a positive way. That can be achieved by working through the Race Equality Charter Mark. I've included in the report a couple of links to that in terms of a link to the Charter Mark and what it is. And there's also a link to a video where you can see several schools talking about their implementing the Charter and the work that they're doing to work across that Charter. I don't know if any of you had an opportunity to have a look at any of those links, but it's a really positive piece of work. In terms of the free school meals working around attainment, we still continue to work really closely with St John's through a number of projects, both in the early years, which I'm sure Julie can mention, and the work that the St John's Foundation are doing with the 7 schools in Baines who have the largest attainment gaps through the Primary Empowerment Project. And then we're doing another piece of work with St John's, working with an organisation called Big Education Trust, who have been doing a piece of work looking at the attainment gap and developing really effective strategies. That's a 2-year project. We're in the 2nd year of that project. It's got some really positive aspects to that in terms of some of the information they've provided in the reports they've done. We would like to have better engagement with some of our schools, I would say, at this point, around how they engage with that project. So I will stop there. There's a lot of information in the report. Some of it does sound very familiar to previous reports that have come here. But I would like to invite my colleague Amy to just talk a little bit about the role of public health before questions, if that's okay, because I think there's a really interesting project developing from our public health colleague.
Thank you. Over to Amy, and I might actually ask Judy just to come in afterwards around the work that that you're doing in early years as well. Thank you.
Great, thanks everybody. So just very quickly a little bit about my role so you can understand why I'm sitting here. So my portfolio covers sexual health, health protection and health side of emergency planning, but also the wider determinants of health. So I tend to get involved in these cross-cutting issues. So for example, some of the questions that you were talking about earlier, I would get involved in supporting the development of the local plan, the green infrastructure strategy, those sorts of things. So hence my interest in wider determinants of health. The project that we're just starting, and this is why it's really helpful to come to scrutiny today so that you can help inform it rather than just us presenting a report at the end, is about a whole systems approach to improving educational attainment or outcomes for our disadvantaged pupils. So it's looking at that whole systems approach. So recognising that the work that education colleagues and education settings is obviously crucial, but recognising that there are a number of determinants outside of education settings that absolutely also impact upon educational attainment and that inequality that we're seeing. So this piece of work is trying to support, really, education colleagues and education settings to say, actually, yes, those other wider determinants are going to be really important. How do they translate in BAMEs? We know quite a lot about what they are, but how do they actually translate specifically in BAMEs? And then what can other council departments and other partners across the systems be doing, where they may already be doing great things, but in addition to supporting the reduction of this attainment gap. So there's a number of different ways in which we're going to look at that. One is, or firstly, by looking at the data. So a lot of the data's there. There's been quite a lot of analysis already, but we'll do that kind of piece where we triangulate it and bring it all together. We'll also be doing a literature review. And I say we have a public health registrar that's going to support this work as well, called Josh. So you will meet Josh at some point. Hopefully we'll be able to come back to scrutiny. So we'll do that literature review, and that will be looking at the both the risk factors around this inequality, but also the protective factors, because the protective factors are really important to put in place to support that reduction in attainment gap. And we'll be looking at what works. So we'll be looking at the published literature, but also what we call as the grey literature, but also looking at other local authorities and other systems as to where they may have a whole systems approach, they may not. And then the final part to it, the third part of it, is doing a qualitative piece. So that's where basically we'll be going out to talk to people. We call them informal or semi-structured interviews and focus groups, but essentially they're quite informal discussions. It's helpful to have a methodology so that we have consistency in the way that we're approaching it and the sorts of questions we're asking and how we're asking those, so we don't introduce unconscious bias, for example. There's a number of different stakeholders that we'll go out to talk to. I've got a list here, my battery is going, but that they will include young people themselves. They'll include young people that are able to reflect and look back on their education and their experience. We will go and talk to those in school settings because this is about outside of school settings, but obviously they will have really good insight into the things that they find it less easy to influence, so those things outside of the school setting. We're very mindful that there's been a lot of work done with schools already, so we're talking to the authors of the report and the research so that we don't kind of duplicate, so that this is about kind of enhancing rather than going in and doing the same stuff. We'll also go and talk to health partners, third sector, anyone that is in touch with young people, kind of right the way through from early years, right the way through to primary and secondary education. And then essentially we'll come back with a report of our key findings and recommendations. So that's what we're doing. We have what we call a project initiation document which describes that. So it sets out the aims, objectives, the scope of the work, what won't be included. So I think it would be really helpful if we circulate that to scrutiny so that you have the opportunity to feed into that and come back to us with any questions, comments or suggestions. And then we'll do this piece of work, which will take about 4-ish months. We're hoping Josh can complete the work that he needs to do by the end of June. And then we'll have to have a discussion about it. I think what's really key, though, and which I've discussed with Chris, is that we don't just go away and do this piece of work and come back. It's really important to have the right partners involved in checking it and informing it as we go. So we'll think about what governance sits around this, or even a kind of what working group sits around this, so appropriate people can inform it as we go along. So I'll stop there. Thanks.
Thank you very much, Amy. And as I indicated, perhaps, Judy, you could also give us a little bit of flavour of the work that St John's is doing, particularly around addressing the attainment gap. Thank you. Could you just speak a little bit closer to the microphone? For some reason, yours is very quiet.
Let's try that. There we go.
Okay, is that better? Oh, yeah, that's better. Okay. Yeah, going back sort of 5-6 years, we were beginning to think about how we could get some focused projects together to address children's communication and language needs. The outcomes for children in receipt of free school meals in early years has been a long-term trend, and that small cohort can have an effect because obviously every child matters within that cohort, and that interrelationship between the risk factors for children that evidence shows may impact on their outcomes changes year on year. Generally, our outcomes are lower, but were beginning to go up before this year, where I think we are seeing the result of the pandemic coming through in the cohort. Obviously, my team, along with the other teams working in early years, have been looking at this for many years, and it's our key work. And we put in a bid some years ago to the DFE, quite a huge bid for a lot of money on a number of different projects. We weren't successful with that. And so at that point, St John's Foundation had begun to fund the Primary Empowerment Project. And some of the elements of our wider bid, we felt we could link through into that project. So we pulled together a bid based around the earlier settings that link into the primary empowerment schools. So our earlier settings in Bath, North East Somerset are mainly private, voluntary and independent. We don't have so many in the schools, in school nurseries now. So there's an element of having to engage that sector. So St John's were really interested in this, and they agreed to fund the project. So it was a partnership project between HCRG, Speech and Language Therapy Services, the Early Years Service and St John's Foundation Fund. And we called it Language for Life, Making a Difference Together. And what the project involved was a structured communication and language toolkit that could be used within settings to support children while they're waiting for maybe referrals to speech and language therapy, or particularly for the group of children who are unlikely to go on to get further specialist support, and so their support needs to come in setting. So the focus of this project was that amber group of children, and to get those children to green before they moved on into school. And the beauty of the Welcome Toolkit, which is the one that St John's purchased in partnership with us, was that it gives practitioners an idea of how to step up, step down, so there's regular screening, and then how they can support those children without needing specialist support. But the St John's also funded the full-time speech and language therapist, so alongside the toolkit, the early years practitioners have had access to that specialist knowledge and support as well. And what we found at the end of a 2-year pilot is that it really has made a difference to the children, and particularly to that amber group of children, and getting them to move into the green band. And that's particularly clear when you look at the children in receipt of pupil premium. So we're now in a position of having put in an application for a further project to roll out widely across the local authority. And we at St John's have agreed the next 2 years. So we're really pleased to be able to continue the work that we're doing. And all of this work really focuses, it is based in the evidence base. So we know that research from the Education Endowment Foundation shows that a focus on upskilling the workforce to support communication and language development in a structured way makes a difference. Strengthening transitions and partnership with parents. So this project engages the parents of the children as well, and it supports the information that goes across into schools so that the reception teachers have been able to pick up from where the settings left off in terms of knowing where the children are in terms of their communication and language development. High quality provision is really important, and we've got 100% good or outstanding settings, all bar one group-based setting, which is currently at RI, and accurate assessment. So some of the work that we're doing around re-engaging our reception teachers as well, because ultimately the reception teachers make that assessment on the profile. So that's, we see, when we look at that EYFS profile data, what we're seeing is the work of all the services, really, pre-birth, all the way through, health visiting, early years sector, into schools, and all of those things are going to make a difference for children. So that multi-agency working is that last factor that can really make a difference for those children. And so we're working around all of those areas, and the Language for Life Making a Difference Together project is a key part of that in terms of it being the structured early language project. So yeah, we've got some clear strategic plans, a strong team, and we work very well with our partner services through the Early Childhood Outcome Group, where we're focused on closing the gap.
Well, sorry, were you carrying on?
No,
sorry, you paused. I wasn't sure whether it was to breathe or to...
That's all on the project. I mean, there's lots of other work going on in early years.
Yes.
And I think, as Chris said about the schools, one of the key things is engaging the academies back to cluster with each other. And we're doing some really good work there. We've already got a nursery class cluster off the ground, and now we're working on really building the cluster with reception teachers so that we can begin to look at some of the issues around closing the gap and begin to moderate again together. Because when the DFE reviewed the Early Years Foundation stage curriculum, they removed the requirement for local authorities to moderate the Early Years Foundation stage profile data, which is the data that we're talking about. So we have we don't know if the data is accurate. I'm just going to put that out there as well, because we're not expected to moderate that now. It's now a low-stakes data point in a school's data progress year. Has anyone got any questions that they'd like to ask?
Yeah, Judy, do you want to turn your microphone off so that... Okay, thank you. So I think that was really useful information, and you may well have answered all the questions the panel have, but I wouldn't count on it. Any questions from the panel at this point? Paul, and then Liz.
Yes, first of all, to our democratic services, the links don't work on iPads, so can you, before the meeting goes out next time, you check the links so that they all work? But certainly on my iPad, none of the links work, which makes it very difficult when I'm in the meeting here. I can look at them at home, perhaps on a different computer. I'd like to just ask a bit more about the underachievement of our black and ethnic minority children, and that covers a wide diversity of people. Within the black and ethnic minority community, are there certain sections that are performing okay and others underperforming? How does that work? Because certainly if you look, from my perspective, looking at those in Southdown, people from a couple of ethnic minority groups are doing very well, and a couple of other ethnic minority groups are disproportionately not doing well. So when you lump them all together and they're still coming out bad, how are the figures covering good groups that are performing well and groups that are underperforming? Are the underperforming really badly underperforming? And if so, what are you doing to address that?
I think if you go to, there is a specific slide, and I appreciate you've not been able to look at the links.
Sorry, Judy, can you turn your microphone off, because it just makes, you can only hear one microphone at a time.
And I appreciate you haven't been able to access the slide deck through the link, so I can get that sent to Mark so we can email it round. But if you do go into the strategic evidence space, it does break it down by ethnicity in terms of performance around that, and you will see that some groups of children, as you've mentioned, perform as well, particularly black children around attainment as well in Baines. And that is the focus, partially a focus of our work that we're doing around the Race Quality Charter Mark, is to see how we can work constructively and positively with schools to raise that. More importantly, to put a focus on it and a spotlight on it, as we are doing around exclusions as well, because more time out of school also will affect attainment. So the role of the local authorities, I mentioned at the beginning, is to put a spotlight on these issues and then try to find ways to work with our schools, our partners, to do that. We're doing that particularly through the Race Equality Charter Mark, where we're having a focus on exclusions, but we'll also focus on curriculum, what we can do to support schools to support children's attainment. When you've got the links, you will see a link to a video where you see 7 schools presenting really practical examples of what they're doing to support the outcomes of those children in their group. But apologies, the links aren't working for you. Did anyone else have problems with the links through the report? I'll make sure you get them by email to access them.
Okay, well, if you could just send the slide pack around, I think that would be very helpful. And thank you. So on my list, I have Liz, and then Kevin, and then David. So, Liz.
It looks like we are very ineffectual in what we can do, Chris, and other education people here present. And it looks like we're dependent on the School Standards Board to implement some of the things that we are talking about. And it looks too general to me. I mean, we've talked about Key Stage 2, the underachievement generally, that we've slumped below national figures for the first time ever. And we're failing so many of our pupils. They're a minority, but we're failing them. We're failing our black and mixed ethnic groups. We're failing our free school meals, and we don't seem to be able to do anything about them. And I know, Judy, you are talking about what you are doing, which with St John's Foundation, which seems to be one of the main things we're doing. We don't seem to have any other plan to improve things. And Amy, it's good to hear from you. You seem to be doing a lot of talking, but hopefully you are going to be highlighting areas such as the number of exclusions that are above average nationally. And I'm not just saying I attended this, but I attended a violence reduction partnership, and they were going on and on about the pipeline from exclusion to prison. We're not talking about, underachievement. We're not talking about not getting jobs. We're talking about prison, and that is this pipeline. So my first question, Chris, is can we do anything within the School Standards Board? Because now that most of our schools are academies, it looks like we don't have the teeth to do anything. You said we're putting the spotlight on exclusions. I think we need to be doing more than that. I know with the virtual school, as soon as a looked after child is about to be excluded, the virtual school goes straight in, and they've really halted and reduced hugely the number of exclusions. I mean, is there anything we can do about that? It looks like for black children that we've got this charter. Is that the only thing that we're doing? So that's my first question. What actually can we do as a local authority? My second question, if this is okay, was about exclusion, and I think exclusion is something that really we do need to be looking at as our results, as our exclusion rate is above average nationally. And then the very last thing to say is that, just to correct this, in the report it said the majority of our schools in Baines, our secondary schools, are outstanding. Actually, it's good or outstanding, and I think whereas it would be lovely to say they're all outstanding, they are good or outstanding. So there's a lot of information, there's a lot of detail I'm putting into this question, and I'm not sure what the answers are, but I really think we could be doing better as a local authority. And I'm not sure if we can actually do better given the academy system.
Yes, if you could answer that very swiftly, Chris.
Thank you, Liz, and thank you for the challenge. I'm going to pick up what we're doing because we are doing more than I think you've highlighted, and I think I've mentioned quite a lot of the additional things we were doing in relation to that. So if I pick the piece up around exclusions first here in Baines. So In relation to exclusions overall, so we are bringing down the numbers of fixed-term exclusions and permanent exclusions this year. We've moved the team that's responsible for supporting children who are excluded from school under the virtual school. So it now sits there, and we've been implementing new policies and guidelines for schools to follow. We've also put in some additional resource into that team. So we have what we call an inclusion coordinator who goes into schools and provides schools with practical advice and support around behaviour management. Today, there is an interview for another one of those posts, so there'll be another person particularly focused on primary. And there is a definite reduction in the numbers of permanent exclusions in Baines. So we are doing a lot more in that area. In September onwards, we will be launching a Send an Alternative Provision advice service, which will have a mixture of people with skills from Senkos to staff who can actually do for practical advice. The advice service will be going live in September. We're investing a significant amount of money from the DSG to put that service in place. Liz, you're right, it has been a real challenge over the last few years. A lot of the services we used to have to support schools, behaviour support service, learning support services, were all removed. We no longer have a school improvement service within Baines. So when we're doing these things, we're doing it through a very small amount of people across a lot of different organisations. So I said it's quite complex. I have to work with a number of trusts. So around those areas of work, we know we can do better, and we are doing better with our performance, and we'll be doing more around that. I think the other point was around St John's, and we're not just doing Language for Life, I did mention two of the projects that we're working with St John's on, which is the Primary Empowerment Project and the Improvement Educational Disadvantaged Outcomes Project. You're right, Liz. What we aren't yet is seeing the results, particularly around those cohort of children. And I accept that's a fair challenge. I don't accept that that is because of the academy system, because when all the schools were maintained in Baines, we had the same issues, particularly for that cohort. So there's something else going on. I think it's more about focus and organisation. And that's what we do have to do, is bring focus on it. The standards board is tomorrow. So the first item on the standards board tomorrow is the regional director's report, which is going to be in the local area plan. And the first item that the regional director will be saying is where there needs to be areas of improvement on, will be around Key Stage 2 and the attainment gap. And then there's some information in the report around other priorities in the area. But one of the other priorities for the local area is around reducing exclusions, particularly for black children. The second item would be me going through this again with the trusts and going through that. Amy's joining me tomorrow, so we're going to have a think about that. But the real challenge is, why is this happening? And what's going to turn the key? And I'm not sure we've completely happened upon that yet in Gaining Baines, so I do accept your challenge, but we're not doing anything. We're doing a lot. We've just got to find that key strategy. There was a third, wasn't there, Liz? Sorry. Yeah. My colleague Amy would like to come in as well.
Thank you. Thanks, Liz. I agree. I think that the work that we're doing around a whole systems approach needs to be action-orientated, so an action plan is going to be really important. And when I mentioned governance, it's so key to get that right. We've got to have the right people around the table, but that will then own the actions, because otherwise we all know that developing reports and then putting them on the table doesn't work. It's building the momentum and the commitment from others across different council departments, but also from key system partners, which is going to be really important to that. But some of them will be tangible, and some of them are going to be really, really tricky, entrenched issues. But I think the qualitative piece in particular will be really interesting in trying to understand some of the nuances underneath all of this, and some of the things that are kind of more specific to Baines. Hopefully, we'll see. We'll see.
Thank you. I know there are no easy answers, but it is really important to highlight things that we really do need to look at and improve on. Thank you.
Thank you, Liz. So next on my list is Kevin, and then David, and then Joanna.
Thank you, Chair. Yes, thank you. Can I just clarify, when you're saying the attainment gap is the worst in the country, are you saying that the actual free school meal attainment is the worst in the country, or is that just the gap that's the worst?
The gap.
So could you just clarify once more where the free school meal attainment is by itself in terms of national averages and regional averages?
I'll have to clarify that with my with the business intelligence team. If it's not clear on the report, I can get that exact figure for you.
Okay, because I think it's important to decide whether we are talking about a gap, and yes, there may be some particular characteristics around high achievers and low achievers, but it's important also to try and focus the fact that we are doing the very best for those children that are lower attainers at this point in time. It seems that there are an awful lot of factors, as you have all said together, at play here, and we've said for many, many times that there are resources that necessarily we didn't appreciate back in 2010 that we don't have now. And a lot of what you're saying around putting things back into the system means we've lost an awful lot of connections, and we're just dabbling back in particular bits. And probably when you get to the public health viewpoint, if you're looking at the coin with St John's Foundation from a sort of council-wide system, that all those things around housing and all the things that St John's have been looking at as well, there's an awful lot of services and things that we don't have. I don't know what your comments and thoughts are around behaviour in schools and the links to suspension, mental health and permanent exclusions. I know I've been party to a few conversations with CEOs around the fact that they are just going to say, it doesn't matter if you haven't got the support services for us. If you haven't got it, fine, we're excluding, because we have other children that we need to worry about. Again, your thoughts around that. So how much of all this is down to the fact that there is nothing left in education in terms of capacity, in terms of probably the same factors that the NHS faced when it hit COVID? There was a catastrophe, and then suddenly everything was revealed in its glory, sadly. And all the lack of this and that became very apparent. And I think that we are sort of constantly getting from schools the message is, we have nothing, we're getting less, just like you, the councils, we can't cope like this. Now, I know that doesn't necessarily, Chris, go back to your particular points on these ones, and we're still where we are. But if we're not moving forward, we can't unless we've got something to move forward to. So just some thoughts on those thoughts.
Yeah, there's some observations in there, aren't they, really, which I don't necessarily have, for me, to have a direct answer to, really. I think there are, with the time machine, decisions perhaps which haven't helped us previously, but then the budgets were what they were at the time, and people probably had to make those decisions in relation to what they thought was national policy around what was going to happen around academisation. I think what was really clear is the role of the local authority, regardless of the level of academisation in an area, still remains really, really important, particularly around vulnerable children. And I think it's been hard. It's got harder over the last 3 years, I would say, because of the increase in vulnerability. Since the pandemic, we have had an increase in children who have needed additional support through our SEN team. We've had an increase in children who have needed additional support from our attendance and welfare team. We've had additional support who have needed support with alternative provision because of their well-being and their health. We have seen a real increase in the numbers of children wanting the service, and I think that's where we felt it there. We kind of managed okay prior to the pandemic in relation to that, but once the pressures have built up, we've not had the resource there to do it. And I think what we're trying to do, particularly through the work we do in the safety valve, is make sure we've got a better offer to build on the really good connections that we do have with schools. What I don't agree with is that we've lost some of those connections, so we still have really good connections with all our Sencos in Baines. One of the first things I did when I came back to Baines is reinstate the Senco conferences, and they are really well attended, and we're pushing an open door there. So what we're going to make sure is that the local authority offer around that group of staff is much better, and that'll be through the Send and AP Advice Service. In terms of pastoral support, we still organise and run the behaviour support and attendance panels in Baines, and we still make sure there we have representation there. So we have really good links in there, and what we're going to try and make sure is that we've got a better offer for those schools around behaviour. So I think we're doing all the right things in terms of what we're doing, but we are facing some significant challenges because of the volume, and when you hear from Laura shortly around that, we're particularly facing a real challenge to make sure we're supporting those children with their SEN in Baines at the moment. I think Julie might want to help with one of your answers.
Yeah, I just wondered if I could just add in about the challenges facing the early years sector. Obviously, there's major issues around the levels of funding that they get for the early years entitlement, but also the staff turnover has had a massive impact post-pandemic. And lots of our settings are struggling to get the staff, the qualified staff that they need. And so we are supporting that by setting up a recruitment microsite for Baines, so to try and sort of kickstart people wanting to get a career in early years. But a lot of our settings have had to reduce their places because they just can't get the staff. The fact is that you can earn more in a supermarket than you can supporting the education of the next generation of children. And that's a really sad place for us all to be, I think. But we do have excellent buy-in with our early years sector, and we run a very low-cost, accessible traded programme, so we do have the opportunity to put on all sorts of courses that are relevant and based in the data and what we're seeing, the messages coming through from the data. And people do, we do get the sector coming out in their own time, in the evenings often. So I think that they're doing their best under quite difficult circumstances at the moment. And a lot of our leaders and managers would say that they can't get the quality of staff they want, and they can't get the quality of managers as well. So hoping that will sort out over the next couple of years, but it has been a real issue over the past couple of years. And that's a national issue.
And I think, sadly, whilst we recognise all the challenges, that doesn't help the children who are, at that stage in their education. So, I know it's hard, but I guess what you're hearing from here is, thank you. Please do, not just do your best, but do better. Thank you. Kevin.
Sorry, Chair, just one other thing around, has St John's Foundation, two parts to this question, are you and your public health role working with the St John's Foundation on this closely? Because that seemed to be the bit about them doing other things around schools as well as, yeah?
So we're now linking with them. So this is I'd say it's an aligned project. So it's not within the work that they're doing. It wasn't within the original scope. So their focus is on educational settings, but recognising that they've gone to speak to teaching staff, for example, about educational settings, but other things have come into that. We're linking with them to understand exactly what they've covered, and then our work will supplement what they're doing, essentially. So ours is an in-house project, but it doesn't duplicate, it aligns with by looking at factors other than what they've been looking at. They've been mainly looking at what education settings can do to support that closing of the gap, where we're looking at other factors, so the wider determinants.
Right, because I was under the assumption that St John's were also looking at family life, their situation, home and things like that, housing. So maybe they haven't gone into that much detail, which you might pull into the equation, is that right?
And we haven't finished having discussions with them, so far we've only spoken to 2 of the authors for one of the reports. So we're talking to them because, yes, we absolutely don't want to duplicate what they're doing. And some of what they have collated we will be using as in to inform our work as well. Yeah.
And don't forget to include the CEOs when you have your discussion before you do the report. Chris, on the St John's itself, the pilot project, is that now finished? The bit about what they're learning and what they can pass on that you hope to spread outwards into the council, and not just the language of life bit, but the other parts of the primary empowerment project.
No.
Yes, before you answer, I just wondered, do you think it'd be helpful that we actually had a full report about the work that's happening at St John's? Just wondering, because I think we spent an hour on this issue already. It might be perhaps useful for the future to actually get some more detail on exactly how this work is helping to address that attainment gap. Yeah?
Yeah.
Okay. I mean, you can carry on finishing your sentence if you want to.
I've got a meeting with St John's in a few days' time, and I'm more than happy if the committee want to do that, asking them to do that.
Okay. Does that address many of your questions then, Kevin?
Well, yes, it'd just be good to see what's happened, really, and where it's going. Yeah.
Okay, thank you. Right. I shall go back to my list. I think David, then Joanna, and then Robin. As I said, we have had almost an hour on this item, and it is a very important item, and that's why I have allowed it to go on as long as it has. But could we have slightly fewer speeches and more questions, please? That's particularly you, Robin.
Thank you, Chair. If I may, Chair, make a couple of observations. I would like to ask the team, really, Public Health, Education, our Cabinet Member and the panel, really about persistent absences from infection. To some extent, I feel that children have been ignored in terms of preventing infection over the pandemic, primarily because most of them don't get so unwell. But we have had 200 deaths from children from COVID, which is more than many other infectious diseases in the time period, and we have tens of thousands of kids who have got long COVID. For instance, in the period in the ONS survey, which was in June 2022, they estimated that 50% of 8 to 11-year-olds caught COVID between December and April 21 to April 22, and that 90% of young children are thought to have been infected by COVID by June 2022. We know it's not a benign condition. We know that it can affect, beyond long COVID, it can affect many other organs, and you've seen increased risks of things like diabetes, etc. We have a national policy which seems to discourage parents to want to do testing for COVID. We have children encouraged to go to school when ill and infectious, because government now says it's usually appropriate to send their children to school when they've got various symptoms of coughs and colds. So it's not surprising to see that we have a higher rate of infection in schools. And I just wonder, clearly we're in an environment we can't do much about a lot of those things, but I'm wondering what we are doing or can do locally. For instance, going way back now, CO2 monitors were given out to schools. There was advice on improving ventilation, etc. But do we know, for instance, that the schools are still using their CO2 monitors, that they're working, what level of CO2 are they trying to act on to put an intervention in? Because there was some confusion regarding the levels of CO2 and the advice at which schools should act on. Can they actually act? Is opening the windows enough? Do they do it? Have we got things like air filtration systems and UVC things in place? My point is that I kind of feel that we're in an environment where we can improve the air quality and prevent some infection for our kids, but are we doing it? And should we, as a panel, be thinking about this as a future work plan?
Thank you, David. I don't know which wants. Amy,
I'm happy to
guess.
come in.
You're
That's
taking this
absolutely
first.
fine. So there's a number of things there. I was just writing
David,
notes.
can you turn
Excuse
your
me.
microphone off?
Oh, can you hear me okay? Is that better? There's a number of things there. So I haven't looked at the infection rates in schools recently. We were doing regularly, kind of very proactively, which was very helpful. And we do periodically because it's helpful to understand if there's an issue, essentially higher infection, and that hasn't been reported in relation to numerous infectious diseases. There is, I mean, as you will know, there is less COVID circulating in the community, and that's because of the impact of the vaccination programme, which is ongoing, and public health support health with that, particularly around the outreach work. So we try to reach those people that are eligible for vaccine that tend to be underrepresented. So we go to their settings, their communities, to make that easier for people to access. And currently, COVID is less virulent, so it's not causing some of the... Of course, in some people, it absolutely is causing serious infection, but generally, that has gone down. It's still, obviously, a really important infectious disease that we are trying to prevent and mitigate. What the government has done is, rather than having separate guidance around COVID, advice and information about COVID has been included in refreshed guidance for all respiratory infections, because actually a lot of the measures that you have to take are similar across respiratory infections, so it makes sense to do it for flu and other respiratory infections as well as COVID. So it's still important, but we're trying to address it as part of a number of different infectious diseases. And UKHSA, the South West office, do have a really good relationship with schools. We do as a local authority. I think... I'd like to say all schools, but certainly most schools in Baines would know that they could contact the public health team at Baines Council if for some reason they were finding it tricky to get hold of UKHSA, and we would support them as appropriate. I don't know which schools are implementing more measures than others, but certainly some will be. Certainly at my children's primary school, they are still using kind of ventilation, CO2 monitors, etc. So certainly they are in place. But what tends to happen is you would then, where there is a situation or an outbreak, we would advise and they would step up what we call control measures as appropriate. So I'm not sure if I've answered all of your questions, but really happy to have a discussion outside of this.
And what we could also do is we've got a COVID report coming to our next meeting, so perhaps we could tack on a bit more information about children as well onto that. Would that be useful, David? Okay, thank you. Amy, do you want to turn your microphone off? Thank you. So Joanna and then Robin.
Hi, so you're saying that you're going to organise yourself over the next year into a new sort of strategy? That's what I'm hearing from you, both? You were saying that you're looking at your organisation of how you've got a sort of strategy going forward, that you're going to have a meeting tomorrow, that there's going to be a realignment of how you do things.
Do you mean in relation to attainment, or do you
So in terms of Kevin's question, you were answering about how tomorrow there was going to be some meeting and you're looking at a strategy of how to move forward.
So tomorrow the regional, the South West Regional Director's Office will present a local area plan, which is a plan that the Regional Director's Office will look to implement with the support of the local authority across all schools in Baines. And in that there's they want to develop a set of actions around what are we doing to improve Key Stage 2 attainment, what we're doing about those exclusions, and other bits of information which are based on
Okay, so thinking about that, in a year's time you'll probably come back to this scrutiny meeting and give us an update what do you expect to achieve in that year?
So in that year, it would be very hard to say we'd be able to say that we would have closed the attainment gap by this time next year. It's a very complicated thing, as Amy has said. But what we do want to know is a lot more about it. We want to know a lot more about what schools are doing, what opportunities they're able to take from the advice and support that the local authority is putting on the table for them to take that advantage of. In that year, we also will have implemented the Send an AP advice service. So that will be up and running and operational from April. So there are a lot more support around that. And we would like to see some of those reductions in exclusions coming down. We would have opened up a number of new resource spaces. We should be quite far into building the planning for the builds around the 2 new schools. And we should be working really clearly on those aspects. And we are working really clearly on some of those areas where our children don't do as well in school with Baines.
Thank you, Chris. I just wonder whether we could do more than just wish to or like to see this, but we could expect to, and we will be questioning why not in future. Because, I've been a councillor for a long time. I've sat on this panel, in various forms for a long time. And there's a frustration, certainly on my behalf, and I think this is being picked up on others who are less long in the tooth, that it doesn't seem to be getting better. So we need to do better. Thank you.
And more than that, it seems like, we endlessly sit here and we hear officers, whatever the subject, be it the dentist or whatever, telling us that these things are going to take place and then. These things are going to take place and then. So I hear that you're having a really important meeting tomorrow that's going to set out the next year. But I'm a bit frustrated to think that I'm going to sit here in a year's time and hear that, over the last year we did this, but we're still where we are. That's the frustration. So I guess it's like, how are you actually going to achieve something within that? And therefore, I'm like pulling at you to just think about what that means rather than another sort of sitting here and hearing the same thing go over and over. And for me, there seems to be something about poverty and there seems to be something about housing. And that seems to be the problem for a huge number of young people, is they don't live in housing that is adequate, that is stable, and that there is not enough, literally, whether it's food or resources on the table for them to ensure that they have a good quality. That's what we're looking at. And nobody seems to ever use the word poverty. I'm tired of the word cost of living crisis. It's poverty.
Thank you, Joanna. I'm sure that's been taken on board. Are you just going to say yes, you're going to do it?
Look, I think it's really important to put the context about what we're trying to achieve and improve. So I've got no doubt that we can do better work and we'll have better outcomes around exclusions next year, because our data is already better. And that's a piece of work which we're really confident about. We've done really tangible things about putting additional staff in place, putting clearer strategies in place around that. I've no doubt about that. I've no doubt that this time next year we will have more additional spaces for our children with special education needs in Baines, because I can see a really clear timeline around builds and when they think they're happening. The attainment gap is a real, I'm not going to lie to you, that is a real challenge. And as I said earlier, unlocking the key to that one in Baines, there's a whole host of directors before me who I don't think have quite got what the answer is to that. So I'm not going to sit here and say, by next year, I will have had the magic bullet around that particular issue here in Baines, because I do think it is much wider. I think you're absolutely right. It is about the wider determinants. It's about housing. It is about poverty. But I think that's the role that our public health team are going to take. It's about actually what are we doing as a council. Because I can work with schools on lots of strategies. I can pull to best practice. But what we need to do is have a joined-up strategy around this in Baines. And I'm not sure I've ever seen a joined-up strategy. We've had initiatives which schools can take part in. But whether if I've hit the nail on the head around how to improve that attainment gap in Baines by next year, I'm going to sell it. We're going to help work it across. So I will commit myself to achieving and improving some of the other things, whether I'm here next year saying we've absolutely nailed it in 1 year and that those children in Key Stage 2 are improving better. I can't say that to you.
Well, you can guarantee that we will be asking hard questions.
Oh, I
next year.
guarantee it. You know, as I said when I came here, you know, I feel like I'm reading the same report from the previous year, and it doesn't feel great.
Thank you, Chris. Robin, you are my last speaker.
Thank you.
Not speaker, questioner.
Questioner. Thank you. Got a question about the relationship between attainments, the pupil cohort as a whole, and those in receipt of free school meals. And the question is about, are we sure that everybody who is entitled to get free school meals is actually claiming and getting it? And I guess we know that the answer is no. What is that gap? And what are we doing to make sure that gap closes? Are we taking proactive measures as they are, for example, have done up in Sheffield, I understand, and other places? Because clearly that is a great benefit to families who could claim free school meals but aren't. It also clearly gives us better statistics in terms of attainment and presumably as well as resources, because the percentage of free school meals actually has that knock-on relationship. So there's a question about take-up of free school meals. Second one is about the relationship between educational performance and COVID. And I think we all understand that COVID, that lockdown, and everything that happened will be unrolling, if you like, as the years go by with those particular pupil cohorts. What I don't understand, what relationship that has to comparison with the local authorities. Because COVID wasn't just a Baines thing. Surely that should be comparative and equal challenges, equal authorities. You might actually say that some urban authorities may well have possibly more challenges. I'd say as well, again, a question or a comment, and it's, as Joanna said, that the thread that is running through a lot of the discussions we've had today, whether it's recruitment or retention, whether it is educational performance, is down to housing or the lack of it, whether it's poverty, whether it's, we call it cost of living crisis. But the fact that, and there is evidence that people are staying in unsuitable accommodation with their children, which is too crowded or whatever, just simply because they can't afford to move on, never mind comfort for work here. And also just a last comment about CO2 monitors, aerating classrooms and ventilating and the rest. And I have to say, with a wife who is a teacher, opening windows and ventilating is a lot more easy to do in June than it is in January, and maybe that's an issue that improves over the next few months. Hope those are all questions rather than rants, Chair.
You did very well. Any responses?
Can I just come in? The issue about the free school meals and whether we know, whether we don't, that was a question asked at the Cabinet. And quite clearly at the moment we don't know that. So that was the answer I gave at Cabinet. But I also gave the assurance that we would try and press to see whether we could get that information through from the government offices. So we'll be following that up. I think the other point is we've just got to make sure that we're picking up the fact that if you live in Baines and you've got a child in Baines, the great majority are actually served really well by the school system. And the issues that we've been looking at this morning around minorities and how we deal with those minorities effectively as a council, working within the system that's been determined by government for local authorities. Because I've heard a lot of pressure, we're not doing very well on this, we're not doing very well on that. But the simple fact is we've got a dedicated group of officers who are working within that system. And I've seen in other areas where The relationship with the Department for Education is not as good as it is here, and the relationship with the schools is not as good as it is here. And I think what we're actually dedicated to do is to use that system to the best of our ability. Because in 4 years since I was last sat here as a Cabinet member, there was no contact at all with the Department for Education. And now they're meeting us on a regular basis, and they're doing an area plan which is picking up our priorities. So all of a sudden now they're actually talking to us, engaging with us, and that can be, you can say, well, that's the Department for Education, or you can say that's because the relationships that I've seen over the table is absolutely superb, and there is the respect there, and the respect that they're picking up from schools and multi-academy trusts for the way that the officers in this council are working. So it's very easy and correct and proper that the committee should be looking at the differences, but I think we've got to reflect the fact that the schools in Bath and North East Somerset are generally providing a good service. It's the minorities that is the major issue, whether it's the black minorities or it's around poverty. Those are issues which, as officers, the council can't easily deal with those issues.
Thank you, Paul. Have you finished?
Yes.
Thank you. Judy.
I could just say a little bit about early years. Obviously, the first point that a parent gets to engage with funding for disadvantages is the 2-year funding. Even though it's universal now, for many years you've had disadvantaged funding, and the local authority, the DWP lists come into the local authority. That's shared with our children's centre services, who go out and make contact with the families to encourage them to take up that funding if they're eligible. And then from there, the settings can obviously move the children across onto early years pupil premium, and then you've got that gap into school. So it's what happens when the children go into school and whether they then pick up the pupil premium, because that's what we see coming through in the data. So it's hard to, it's that transition that maybe is something to look at with the schools. The other thing you talked about is the educational performance in COVID. That's quite an interesting one, because what we saw in 2022 was the Baines data actually went up 3% for the outcomes for free school meals, whereas the national drop happened in 2022. So nationally, the outcomes for free school meals dropped 8%. And what we've seen this year, and actually going back to that, what I think one of the reasons for that is that our early years sector worked extremely hard to stay open over the pandemic. And so our children in receipt of additional funding and our key workers had a place to go. And I think that means they were probably in settings in smaller groups and may have benefited from that. So this year we've seen that drop come through in our data. And I don't know why we're a year behind everybody else, but that seems to be what's going on there. And it could be, I don't know, who knows, all different sorts of factors there. I think that's probably everything that you asked, isn't it? Sort of. Well, some aspects of what you asked.
Okay, Judy, if you turn your microphone off. Paul, I'll let you come in, but we do have 2 other items on our agenda still. Okay.
I just wanted to sort of ask the committee if we wanted to actually add a recommendation 3. Because one of the problems I find with all our recommendations of this panel is just no. And what I would like to do is actually specifically ask for some work. And it seems to me that I take on board Councillor May's point about the vast majority of our people doing well. That's absolutely correct, and that's always been the case. It's the job of this council and this scrutiny panel to make sure not just the 90% do well, but the remaining do well and improve that. So I was wondering if perhaps we could ask for a piece of work that came back that specifically addressed the needs of our minorities and FSM, and specifically laid out in more detail the steps that were being made to improve that. So if the panel is like, I'd like to add that as a recommendation 3. If anyone seconds it.
Just clarify, are you asking for around black and ethnic minorities and also those with socioeconomic disadvantage as well?
Yeah, free school meals, yeah.
Okay. Well, I think...
Chair, can I suggest, we said that we would get St John's to come along and talk to the committee. We could add that to that report so that we can, in actual fact, pull it all together at a subsequent meeting.
That's satisfactory, Paul? Okay. Thank you. Joanna. Thank you very much, and thank you for the suggestion, Paul. Right, so now we move on to item 11, the education, health and care plans. Can I urge everyone not to make statements? Obviously, I get that you might want to clarify, why you're asking a particular question and giving some sort of context for that. So I'm going to ask Paul to give us any additional information on this paper as part of his introduction. Thank you.
Thank you, Chair. It's been a real issue for us when the rules around education healthcare plans were first introduced and inspected. This authority did much better than other local authorities on those joint inspections. But it's true to say that over the last few years, the increase in education healthcare plan demand has grown so much. And in terms of the officer structure to deal with that, there's been some real issues. But with Laura, who's going to present the report in a minute, we're now turning the corner, and we were spending as much of our time dealing with the complaints around the system rather than actually dealing with the system. So moving this into a positive phase is really important, and I'm looking forward to Laura's presentation in a minute, if we can actually do a presentation, Chair.
I don't know if we will be able to do a presentation, but perhaps...
As far as I'm aware, the presentation from Laura is within your agenda pack. So you can't bring it on screen, but you can have it in front of you.
It is, yeah.
And so if there's anything that you wanted to draw our attention to in the presentation, that would be perfectly adequate, Laura, rather than, a sort of line by line.
Chair, can we just be very clear, though, this presentation, that this is being recorded, it's not going to be seen by the general public?
The papers are available to the general public.
Yeah.
So, can I start off then, whilst my colleagues think of the questions? I mean, it's kind of like a general point about, what is actually being done to improve the situation? Picking up on what Paul had already said, because I think all of us, in our capacities as councillors, get requests, get concerns raised by parents who find the system difficult to navigate and also difficult to get to an end point that they are happy with. So, if that's not too much of an open question, Laura. Laura, would you also mind introducing yourself? Because I think you weren't here when we first did that.
No problem. Good morning, everyone. I'm Laura Donnelly. I'm the head of SEND for Baines. Been in post since September, so relatively new to working in the council. I've been a teacher for 10 years prior to that. You're right, that's a broad question to be asking. We've invested quite significantly in increasing the number of SEND practitioners who are the doers, if you like, within the system, and the management structure above that in order to work with the increase in needs assessment applications that we have, so the request to assess prior to granting the plan. And we have been fortunate to be able to recruit from other local authorities some really high quality staff to be looking at that. But we do have a backlog that we're still working through of cases where we have slipped outside of our 20-week timescales or our 6-week timescales for assessments, and that's really challenging for families. That absolutely is really tricky. We've got a very robust improvement plan in place at the moment that's being supported by our business change, who are looking at 6 areas within SEND for us to improve as a council,
and really holding me and my team to account on that journey. For example, improving communications through the use of technology. So our systems are somewhat antiquated in comparison to others. Our plans are still written on as a Word document, saved, sent out, commented on, sent back, etc. Other local authorities use online systems for that just make it so much quicker and mean that parents can check really quickly. So moving forward with changes with the systems that we use will really improve things. And we're months into that now of a project that will probably take about a year to get off the ground, to have an online system in place and bring us up together with our partners like Bristol who have those systems already. So that's there, increased training for my team, but also the Send an AP advice service working with our schools to help our schools really understand the process, because the turnover of SENCOs is really high in schools. It's a really difficult position to recruit for, and often people don't choose it, they're given it. So, it's decided that it's them for a bit, and they're completely at sea. And so putting in a proper and robust offer of CPD, not to replace what our academies do, because of course that is their responsibility as well, but to supplement in terms of our SENCOs really understanding the process so that they, as the person who knows the family best, can communicate brilliant with the families and young people, instead of officers who really will dip in and out of that family's story and won't be part of that story long term.
Thank you, Laura. Okay, so any comments or points from the panel? Yes? And then Kevin. Go on with Liz first, Kevin, to make a change.
I hadn't realised, and I'm sorry, Laura, if I missed this point. But in the report it says that 24% of parents requesting a needs assessment are denied. And is there any reason for this? And a second question is, I remember with the budget figures that it was something like 204 young people were being sent out of county because of their complex special educational needs. And there's a lot of money being spent on this. And I think there were plans put forward to provide extra places for youngsters with special needs, which could be found within Baines itself. And I know we've heard that we are going to get alternative provision, but have you got up-to-date figures as to how we are going to reduce the number of young people being sent out of county with special needs? Thank you.
Yep, so your first question, and sorry, could you repeat it? Working memory is not my best.
Sorry. What it is that it's surprising to see that 24% of parents of carers who request a special needs assessment have it declined. And I wondered what were the reasons for this, but also maybe it gives me an opportunity now to expand on that a little bit. So do these people reapply, and therefore are they in the figures? So it's not just once they apply. So the 24% may be repeaters, for want of a better word.
So to clarify, these applications predominantly are from schools rather than from parents and carers, although of course the parents and carers are involved in that process. It's the schools that often make the application. We look at the legal test. So at a multi-agency panel, we look at whether or not it's possible that the child may have SEND. That's the first sort of hurdle. And the second one is that requires more than a school can ordinarily provide. And we are allowed to, as a local authority, put some stages in to assess that. And what we put into place is we ask our schools to provide us with at least 2, which is lower than most other local authorities, pieces of evidence that show assess, plan, do, review, or the graduated response, that show that they've tried things within their normal means and they haven't worked, so they reviewed them, tried them again. And it's that bit that we often find really tricky to get that information from schools, a really robust record of what the school has been able to offer for the child, to show that something is needed more than the school can offer. And so you're right, sometimes those do go back to schools and we say, look, we're going to need you to look at it for another 6 weeks because we haven't really got that evidence. They look at it for another 6 weeks and it comes back to us. That does happen. Sometimes it will be challenged through other appeals processes and come back to us that way as well. But we're working hard with our schools, and the Send an AP advice service is really key in this to improve their understanding of the graduated response, or assess, plan, do, review, depending on what you call it, or ordinarily available provision, to improve what schools understand around that, the robustness of the quality of what they can put forward, and therefore the ability for us to really assess whether or not a needs assessment is required for that child. But of course, if their needs can be met within ordinary available provision, that is the correct thing for that to happen, and the school must work towards doing that without the support of an EHCP.
Thank you, Laura.
I beg your pardon,
You
Chair.
had another question.
I had a second question, and it was looking at one of the budget information that we had was children being sent out of county, and it costing quite a lot to our local authority. And we were thinking, or there are plans for extra special needs places for some of these young people, and I would like an update on that, please.
Yeah. So it's most definitely true that too many of our young people are having to travel too far for school. And it wouldn't be our parents' first choice, and we hear that from Parent Carers Forum. They want a local school, of course they do, and they don't want 45-minute taxi drives, etc. And it's not good use of the public purse either. So we are looking, firstly, to open resource bases within mainstream schools. And we know, so nationally, we know that resource bases work really well to keep a young person connected with their community. So special school is a wonderful thing, but it's a microcosm of a world that doesn't quite exist. And transition, and it's right for some, but transition out from that can be really tricky. Resource bases allow you to be around your peers, make friends with people who live locally to you, go to your local school, rather than travelling to Bath if you live in Midsummer Norton, say. So resource bases is our first step, and yes, there have been some hurdles. Rosemary Collards has worked really hard to develop those, and we're building at Ralph Allen, for example, at the moment, to open resource spaces so that more children can stay at a local school rather than a specialist provision, but get access to specialist support. As for our schools, we're working with the DFE to open our new special school, which you guys will have heard about, and you heard about our residential school as well, because we don't have residential provision here. You heard about that at last scrutiny, I believe, when we talked about the Keynsham Residential School. So those things at the moment are sat with the DFE, and we're working really hard with the DFE to move those forward, to find out who's going to be running those schools on our behalf, because it will be an academy chain running them, and therefore how long it will take for us to move forward with those pieces of work. In the interim, we're also working hard with our academy partners to help to increase the pan in some of the schools and the flexibility around the resource bases we've already got, to make sure that wherever possible young people are staying local, particularly our younger pupils, because they're likely to stay local throughout their careers. If I have a year 2 go out of county, they're probably going to stay out of county then for a really long time. And then when they're 16, they've got no local friends, etc. They don't know their community, and it's really tricky. So we're working with our academies as well, and equally having influence over some local Bristol schools. Yes, it's out of county, but for some of our parents, it's actually the most local school. So working with our other local authorities to have that more collaborative approach around placements. Okay.
Kevin.
Thank you, Chair. Thank you, Laura. Well, I'll do, there's 4 questions, but one at a time. Okay, so, okay. What happens, and picking up sort of the end part of Liz's point, I suppose, when a needs assessments are turned down, what happens then in terms of support to schools?
So at the moment we offer a ways forward meeting that our senior inclusion officers offer to meet with the school and the parents and any other, so it's a team around the child meeting really, but any other interested parties, whether that's social care, health, whomever it might be. We don't have a huge uptake on those meetings at the moment, so we are, as part of our Send an AP advice service, investing more heavily in that part of the service so that we have qualified teachers available to go out. As a more of an impartial person to look at the plans for the child or young person, because sometimes these meetings can get pulled into discussions around the statutory timescales or whether or not the plan should have been granted, and those conversations, rather than, all those things are really important, but what are we going to do for the young person right now whilst we also discuss those things? So the actual way forward for the child rather than the way forward for the process. And so the Send an AP advice service will be bringing that in, and we think that that is one of the keys moving forward to helping our schools better improve their practice for young people and gather, as I said, more efficient and effective information about young people in case a plan is needed in the future.
The last thing you mentioned was the Send an AP service. Do you think that that's going to... I was so diligent at turning it off. So you mentioned the Send and AP service there at the end of that part of the question. Will that service replace what's been lost, support services around schools?
No, because that funding has gone out to schools, so it can't replace everything that was lost, but it is signposting to services that are available, because we have a complex system of services available, and quite a lot available in Baines, but it's very difficult, particularly as a new SENCO, to understand everything that's available for the child, or as a parent to navigate that. And so it will be a first point of call, where anybody who's struggling to communicate with the council, struggling to move forward with the council with any of these things, can call that line, and they can be then signposted to other services, some of which we are commissioning as new services, some of which already exist, like HERS or SAS or sensory support, whatever it might be, our behaviour support, inclusion workers, etc. Might be signposted back to my team as well around advice around the statutory service. But it's a way of making sure that our schools have somewhere to go in the first instance. And I do believe over time it will grow to more than that. But at the moment, that's the offer. And also, in some cases, it will signpost back to the academy as well, because the multi-academy trusts all have such different offers. So a child in neighbouring schools could have hugely varying offers in terms of whether there's a speech and language therapist employed by the academy, for example. We will try to collate that information so that SENCOs, again, can be correctly signposted back to their academy chain if they need to be.
Thank you. Number 3, I think I'm up to, sorry. Do you think, given that it seems from the data that you showed us or in the pack, that it seems that behaviour and SEMH are the biggest demands on EHCPs at the moment, do you think the ordinarily available provision is robust, strong enough to cope with the current increase in demand?
Just to clarify, autism is still our highest need within our EHCP cohort, although it is being potentially caught by social, emotional, mental health, which I do want to separate from behaviours, although behaviours can, that challenge our schools can come as part of that. They don't necessarily come as part of that. But the social, emotional, mental health need in our schools is increasing, and you can see sort of autism sitting here and then it's very starting, and it may overtake in the future. Do I think our ordinary available provision is robust enough? I think that's extremely broad a question, Kevin, for me to answer in this forum, to be honest. I think our schools are doing the best that they can with the resources that they have. However, as budgets are being squeezed, roles such as mentors are roles that are no longer able to be employed by schools. Counsellors, etc., hours being cut for the amount of counselling they bring in from other services like off the record. Those things really are being stretched in schools, and our pastoral services are stretched, and that does have an impact on what goes on there.
Yes, I mean, I was particularly thinking that in relation, of course, because the prime aim is to reduce EHCPs and to look back at the beginning as to what schools can offer, and always think about, well, what should you be offering these children first? And my concern is, which you haven't allayed really, is that the resources available to schools aren't sufficient enough in many cases to prevent this escalation.
I take that one. That'd be great. Thanks. It's a really good challenge. Just to clarify, is we want to get more early help services in the Send and AP advice service. We'll start initially as the advice line, and there will be staff there. But then there are 4 pillars, which will mean that we're able to provide more support around inclusion and support, but more advice around quality assurance and around that. So that there will be a much broader, stronger offer from the local authorities. But also, one of the challenges which Laura highlighted is not every offer from a multi-academy trust is the same. And I think that's a real challenge for us. So some trusts will invest heavily in additional support, and others won't. And what we need to try and do is work with our trusts to make sure that we're able to level up some of that offer that's there for parents. But undoubtedly, Kevin, the challenge for every organisation at this moment is budgets, and that they be able to provide that more. We're going to invest more through the safety valve fund and the Send and AP advice service, and we will be building up what the local authority offers. I don't think we're ever going to replace everything that it's gone, but we will certainly be targeted in the right areas. And Laura's right, we do have a number of really good services which are commissioned through the budget already, and the advice service will be there to make sure we're getting the best from those services, making sure that they're directed in the right ways. I think we'll have a much better system, even in 12 months' time, once the service is in place, and we'll have a better offer, and we'll be able to support schools and our SENCOs in making sure that that support goes in better, and that the audio provision has been implemented, the graduate approach has been implemented, because that's where we want things to be really effective. It's going to be really hard to keep growing the SEN team to respond to the volume of plans, because it's really hard to get those staff. But yeah, we absolutely want to make sure that there is a much better offer from the local authority to schools, but that does not replace the schools and the trust responsibilities in that area either.
No, quite. But I think it's also just important to say that the resources available to schools, the baseline has dropped considerably, what it could have been and what it may be. And I quite understand that you're doing the best you can with the systems you have. And in fact, I'm very positive about the fact that the things you're doing. Sadly, it's replacing things that should already be there, or moving things that we had hoped would be there. But my last question, bless, and sorry, Chair, thank you for your indulgence, is just around, and I've tried to avoid speeches this time as well, is just around are the resources available, given the fact that you're putting more resources into the SEN process and the IEP process. Things like education psychologists, speech and language therapists, even with increased investment, do we have enough to bring that down to where you want it to be?
I think those two particular areas, I think, are, even with enormous budgets, hard to fill vacancies. It's recognised it's a national shortage in terms of the number of colleges and universities who train education psychologists, how long it takes to train an education psychologist, does mean that the pool of professionals like that coming through is hard to recruit to. It's an area in Baines which I'm increasingly optimistic about in terms of psychology services. I'm having a much more stable workforce, and I believe last week we managed to recruit another 1.5 education psychologists to come and work in Baines. When EPs come and work in Baines, they tend to stay, which is really, really good. We have had a significant issue with the increase in plans, which has put a real pressure on the workforce. And that will be the same in speech and language, although I think our speech and language wait times in Baines have greatly improved recently. But we certainly did have a real pressure around those. But then you've got other pressure points like OT and things like that, and paediatrics, where it's more of the budget's there, but recruiting the staff is the challenge.
Yep, so that was the bit, are you going to be able to, given all those constraints, bring that demand for EHCPs down, which is the key part of your safety valve promise, if you like, because the government aren't going to give you the money unless you're going to bring down UHCP. So are you still optimistic enough, even with the investment that went into the budget this year, or are you still at a point where actually we've got the money, we just can't move on this one?
I'm not sure how the two questions are linked. Can you just repeat that for me again?
Well, just saying that to bring the HCPs down and the demand and things to keep your...
Yeah.
Will that work, or will you be able to bring it down, given all the things you've said? You're still in a position to bring those EHCPs down?
Yeah. We're not necessarily reliant on those particular staffing groups. So when they send an AP advice service, we'll be looked to recruit in a much broader pool of professionals who have got experience. So that could be ex-SENCOs or current SENCOs or teachers. So it wouldn't necessarily be that skill set. We'd be necessarily looking to recruit from within that. When we have advertised for posts to sit in, like the education inclusion coordinators and people like that, we have had much more success and attracting candidates to work in that from that sector. Sadly, Kevin, sometimes that is lots of applications for people who work in schools. So, solve one problem and perhaps cause another one elsewhere.
Thank you. That was a very cheeky extra question, Kevin. That's okay. I'm going to take Ruth next, and then I'm going to allow Eleanor to ask a question, if it's a question, but you are not allowed to make a statement, as you are not a member of the panel.
To ask a question relating to what's already been said, but could I, in the meantime, beg you to get the air conditioning turned off? It's all very well keeping people free of COVID,
it's a window. It's a window, and it's about, you know, making sure our air quality within this room is good. And I'm keeping an eye on the monitor here, and it actually says that it is at a good level. So I apologise that you're cold, but I think we would all prefer to have good air. So Ruth, and then Eleanor, you may ask a small question.
Thank you. Now, I just have a very quick question referring to paragraph 3.3 about the behaviour support team that visits schools. And I just wondered, can you tell me how many people work in that team at the moment? And then you're saying you're increasing the capacity. So what's the current number, and what are you hoping to increase that number to? Because it sounds like a good service. Thank you.
Laura, can you turn your microphone off when you're not speaking?
Yes. So we currently have one person, and we're increasing to 2. However, within the capacity within that team at the moment, those 2 people will be able to meet the demand that is currently coming from schools in terms of requests to come in. And we are finding that an effective way of particularly, that service does a really good job at looking at our children who are at risk of placement breakdown, whether that's they're at a special school and it's no longer working for them, or whether they're in mainstream school and perhaps there might be a PACS possible in the future. What that's unlikely to do is to reduce the number of EHCP requests that we have at the moment. We would need to increase the team further in the future to be able to do that. But we'll start with bringing in our primary colleague and see and monitor very carefully what happens with those numbers.
Thank you very much, Ruth. Now, Eleanor, you have a small question.
Yes, it relates to autism. We did, I thought, have in about 2018 a commitment by Council to support people with autism, and in the debate it became clear how absolutely crucial it is to get an early diagnosis of autism. So I was wondering if there was any data relating to the average age at which people get a diagnosis. And secondly, there was a very disturbing article in The Guardian last week about the fact there's no regulated way of diagnosing, and different centres have different criteria, and some centres it's 85% of the applicants who are diagnosed as having autism, and in other places 35%. And I was wondering what we were doing. First of all, what age is the average age? Secondly, how these diagnoses are being arrived at, and where we stood in the national tables. And if that's not known, if you could just email us with the details, that would be great.
Thank you, Eleanor.
I don't have that information for you. My role is to look at the statutory service around EHCPs rather than that kind of data. However, I'm sure that we can get it for you and forward it to you.
And you better say who you are as well.
Oh, sorry. Yes, I'm Ian Tomlinson. I'm the Senior Commissioning Manager for Children. I work for the ICB and the local authority. I'm here to present a report on our sufficiency. However, with my health hat on, we're currently doing a pilot on the assessment of neurodiverse children, which should speed up the process. That could probably be distributed, but what I'm saying is we're speeding up the process across Bath, Swindon and Wiltshire and standardising that process. Yeah, that's my...
Thank you, Ian. Okay, right, I'm now moving on to the next item, which is a sufficiency statement. So, thank you, Ian, for introducing yourself, and it's back to you again. Oh, sorry, no, it's not. It's starting with Paul. Then on to Ian, who will hopefully give you some support.
I was going to introduce Ian to you, Chair, sorry. It's our duty to ensure the well-being and prosperity of all our young residents, especially those under care. And this report actually sets out the process in which this is done by our officers to make sure that the systems are working effectively. And I think, although we've had a really long meeting this morning, it's important that we actually do recognise that we have empathy and determination as a commitment to improving the lives of the most vulnerable children in our society. So over to you, Ian.
But only if you turn your microphone off, Paul.
Yeah, it's on. Can you hear me?
No, now we can.
Okay. Am I able to present?
Not to the large screens, no.
Okay.
Everyone has been sent your presentation live.
Yes, so I've already introduced myself. The sufficiency duties placed on local authorities as part of the Children Act. And it says that we're required as local authorities to provide a sufficiency of placements for our children looked after. So how do we go about doing that? Previously, if I'd been presenting here, I might have said we do it by creating preferred provider lists for various types of placements, and those placements are independent fostering agencies as well as our in-house fostering placements, residential children's homes. We also place children in something called 16 plus accommodation and support, and I presented, as Kevin remembered as I arrived, to this committee in the past, because it was previously a type of provision that wasn't regulated by Ofsted, and Ofsted is starting to regulate that. We also place people in parent and baby residential assessment units, and usually that's by court directed. However, because the number of children who are looked after locally, regionally and nationally has increased, the number of foster care households has gone down, although the number of residential children's homes is starting to go up. We have increasing difficulty in providing a sufficiency of placements for our children who are looked after, and the placements team are often fighting with other local authorities to find placements for our children. So what has happened, as I said, increased number of children looked after, decreased number of fostering households. Also, there was some legislation brought in a number of years ago that allowed, called stay and put legislation, that allowed children in foster placements to stay with their foster carers until they're 24, if they so wished. That again increases the pressure on foster placements, because those children are now using up foster placements. And also there's been a significant increase in the number of unaccompanied asylum-seeking children. And I believe, although I don't have this figure in my head, but approximately 10% of our children looked after population is unaccompanied asylum-seeking children. What does Baines need from the market? And I apologise for my commissioning speak, but it's my world. We need foster placements in Central Bath and in Bath and North East Somerset. We need foster placements for 14 to 17-year-olds who have complex and challenging behaviours. We need placements to move, foster placements to move children from residential placements. As a local authority, we think that children, our children, are entitled to a family setting rather than an institutional one, which is a residential children's home. However, some children don't want another family. Some 16 and 17-year-olds don't want to move into another family and make that investment. So for those children, a residential children's home is more suitable. However, that provision is much more expensive than a foster placement. We need appropriate provision for our unaccompanied asylum-seeking children. Many of those don't want to live in Baines. They want to live in communities where they have peers and they can access the Home Office, for example, Croydon. We need solo foster placements for children whose behaviour is difficult to support, and we also occasionally need parent and baby foster placements as opposed to residential ones. So over the years, our number of children looked after has increased. In 2017, we had 163 children looked after, and currently we've got over 230. That shows not only the increase in children looked after, it also has a significant impact on how much we're spending as a local authority. The number of unaccompanied asylum-seeking children, if we take a similar period, in 2017 we have no unaccompanied asylum-seeking children, and now we've got approximately 43. And I've taken those numbers over the course of the year as opposed to the number on a particular date. There are two ways of looking at these things. The number of children who are placed with independent foster agencies over that period has gone up from 90 to 105. The number of children placed in residential children's homes over that period, and again I'm talking over the course of a year, has gone from 4 to 31. The number of children placed in 16-plus accommodation has gone from 8 to 14, and all of these have significant impacts on our costs. I'm just going to really talk about the accommodation and support placements just for a brief period, because I did report to this committee on that. When we place a child in accommodation and support, it does what it says on the tin. It provides accommodation and support, whereas a children's home, and you might find these words difficult to listen to, can also provide care. But in the terms of the legislation, care has a specific meaning in this instance. Care means is cooking for, cleaning for, shopping for, and administering medication. The 16-plus accommodation and support can't do those things, but it can support the children to do that. And the red line for Ofsted, and I was at a conference last week about this, in fact that's the first conference I've been to since COVID, I think. The red line for Ofsted is that those children in 16-plus support have a plan for independence. And that is the main thing, but the providers can't provide care. This was unregulated by Ofsted, and as a group of local authorities, we were in a consortia locally to try and provide some kind of regulation over about the past 5 years by putting through the providers that we purchased from a significant tender process. So we placed a lot more on the questioning and visiting the provision to make sure our young people were placed in provision that we would want them to be placed in. So moving forward, we as a local authority and our placements team, we continue to provide a core service supporting the social care teams in providing finding placements, negotiating the fees and checking the quality of the placements. In the next few months we'll be providing another preferred provider list for the accommodation and support, because that's coming to an end, and we'll be working with something called the South West Sufficiency Project. As a group of local authorities in the South West, we've got together to try and improve the sufficiency right across the region, and there are a number of initiatives going on involved in that, where we've got a fostering advertising campaign that's across the South West, and we hope that will significantly increase the number of provision of foster carers. Any questions?
Oh, that was very quick. Robin? Okay, Robin and then Paul.
Thank you. Thanks for that summary, and I think it's, as a member of the foster panel, I think we've seen over the last few years the pressure, and it comes on both sides. The fact that there's increased demand, but it's also at a time with the cost of living crisis, where families are maybe more reluctant or maybe less able to volunteer for fostering. But I think there's an issue as well of the offer that that we are making as a local authority to potential foster caring families, and it's something that the Labour group raised at the budget meeting, that we should be looking at how our offer compares to neighbouring local authorities as well as private sector providers. I know that a few years ago we were kind of ahead of the game, if you like, for want of a better way of putting it. Ian's frowning slightly. Yeah. Probably pre-COVID I'm talking about. But it's important that we look at benchmarking, we look at what we're offering, and if that costs us some additional money, and I know that the fostering team, I remember the exact title, we're looking for something in the region of £50,000, that may well be, it would be penny wise, pound foolish not to be seriously looking at that.
A little bit of history there which will help how we think about that. Independent foster agencies came into the market probably about 15-20 years ago to plug a gap that they saw that there were increasing number of teenagers with challenging and difficult behaviour that local authority foster carers weren't actually dealing with, and they paid their carers more, they gave them more training, and it was a different offer. So to some degree that still signifies a difference between local authorities and fostering agencies, in that general agencies pay their carers more. I think the training offer is now similar. However, and if you look at how the children are placed, the younger children, i.e. 0 to 12s, tend to be with local authorities, and the 13 to 17-year-olds tend to be with the independent agencies. So there still is a difference there. So we're always comparing apples with oranges a little bit, because we're looking at two slightly different cohorts of children.
Thank you, Ian. Now let me look at my list. Paul, then Liz, and then Kevin.
So my question is a little bit similar to Robin's. I just want to understand the reason why fostering is going down. So Robin said that a key part of it is that we're not paying enough. But is that the only reason? And if it is the only reason, what steps do we need to start thinking about to address that problem?
In reality, Paul, this is not my department. You'd have to get somebody here from the family placement team. I deal with the independent market, and largely that's what this report's about. And I think it's a whole other report. I personally have challenged us to do that, but I don't feel I'm able to answer. I think Mary and a manager from that team would have to answer those questions, and I'm happy to take them away and get back to you.
Okay, thank you, Ian. Okay, Kevin, you've been bumped up.
Thank you. Ian, overall, would you say that this is a good news story, or are you really struggling for placements? And
it's not a good news story.
Kevin,
when I start, I've been doing this. I've been doing this for a long time now. There was a time, probably about 10 years ago, when what happens when we search for a placement? We get an anonymised description of the child, which says what their needs are, what their risks are, and what things they like. I say to social workers, so this is just for your information, I say to social workers, when I've read this report, I want the child to jump off the page. I want to look at it and think, I'm a foster carer, I could do something with this child, I could make a difference. So we send out these anonymised requests for people to provide a placement for the child or a home. And we used to get 7, 8, 9 offers back. And my team used to do an options appraisal that said, this is what's good about this foster carers, this is what's good about this is where they live. And I probably would sometimes, and I'm legally allowed to do this, if one was very much more expensive, I'll probably take that one off the list because in protection of the public purse. Now, if I get an offer, if my team get an offer, I'm saying to the social workers, we really need to act quickly on this because another local authority will take it. And that's where we're at with the marketplace at the moment. And this is a national problem. This is not a problem for Baines. I sit on various national groups around commissioning and procurement of children's services. And I also sit on the National Children's Commissioning Conference, and that's the talk of we can't find placements, we can't find placements, and we're all doing as much as we can to advertise and encourage the market to respond.
Is the fact that things are being taken, if you like, otherwise you'll lose it, causing other problems in terms of... Yeah, sorry. Because you were saying that, you know, if an offer comes in, you're really saying, look, you really ought to take this because we've got an offer. Is that causing other issues and breakdowns and more issues for you in the long run? Or?
I think there's two things that are impacting what you're saying. First of all, yes, that could have an impact on the long term of that placement if it's not the right placement for the child, and sometimes it's not. Although we have had instances where we've placed a child on a Friday afternoon, and we do have emergencies on Friday afternoon from time to time. I remember placing a child on a Friday afternoon thinking, I think we'll be able to move that child next week. And 3 years later, the child was turning 18. So it goes both ways, you can't always tell. But I do think it impacts on the churn in the system. There are more placement breakdowns. That's not great. The other thing is, there are new... Wait a minute, let me get my words straight here. The foster care demographic is an ageing one. And the more experienced carers are falling out of the system. The newer carers, in my opinion, I'm giving you my opinion now, I don't think can cope with some of the children coming through, and that also creates a bit of churn in the system.
So I'm just pausing because you have form.
It was only just the fact that, sorry, that about the training, because you mentioned it before. Is that your area for? Sorry. Is the training bit for new foster? That's not your area. Largely the training is statutory. There is a national minimum requirement on foster carers to complete certain training. Although this is not my department because I'm not involved in our own in-house team. When a placement comes in, we send it initially to the in-house foster carers called family placement team. I used to sit on the panel. In fact, Robin, I didn't actually recognise you off screen. But obviously there is an improved offer above the national minimum standards which most agencies go through because they want carers who can deal with teenagers. I can't talk about our in-house offer.
Right, I'm moving on. I'm not going to pause this time. To Liz.
Thank you, Chair. Ian, I'm not sure if this is your area of expertise, but in the report it does say 90 care leavers stepped down from becoming or having a personal advisor. And I just wondered, so what connection have we got with them? Do we have a responsibility, if they're between 18 and 25, to make sure we place them in some sort of accommodation? And in your report, it does say some of them are actually in custody. So, once again, is this an area that you would cover? And I think we are beginning to think maybe we need a a report on this, but which encompasses all the issues that we've raised, which are not under your remit.
Yeah, sorry, Liz, that is not under my remit. Those paragraphs are put in by Charlotte Kilblaith, who's the manager of that service, and if those questions would need to be addressed to her.
Thank you. Well, we'll put that onto our work plan then, which luckily is the next item. Any other questions for Ian? No. Thank you very much for your contribution. And we're now moving on to the last item, which is the work plan. And there are a number... Yes. And so there's a number of items that I think have come up, from things various people have said, including a non-panel member, and so I'll make sure that's on our plan, which was the report from SACRI. And I think there were some other items as well, the one that we've just been talking about, and exactly how we want that framed. Liz, I'm going to turn to you and ask you how would you like that to be framed on our plan?
Oh, I might need help from other members of the panel, but I think it's looking at the wider implications of accommodation for our care experienced young people. Looking at some of the issues that you raised, Paul, which could you remind us what they were? The one I have is what's happening to these 90 care leavers who do not have or do not want a personal advisor. Where are they? Are we in contact with them? That's that sort of area. And Paul, could you remind me what you asked and Ian said he couldn't respond to?
Can you use your mic, please?
I was really asking what were the reasons why our number of fosterers going around. Was it purely the fact that we weren't paying enough, or was it other social reasons about fostering?
I think what we might do is we might take away the various strands of this, and perhaps we'll circulate a proposed item.
Then we can pick it up in the agenda planning.
Yes, yeah. So we'll pick that up in agenda planning. Okay. I'm fairly sure Kerry's made copious notes on exactly what we're trying to achieve here. Thank you. Right. So I think we also wanted, although I'm not sure that it was really mentioned, but it seems to have been referred to a lot around the work of connecting families, because that feels like that's a very important preventative, part of our prevention work. So I'd like to propose that that's put forward, although, of course, it may not be called exactly that now. And you're looking very puzzled at me, Chris, which I'll worry about.
Supporting families now, I think.
Oh, there we are.
National strategy supporting families. We've still got a connecting families team. But again, that'll be something which I'm sure can be picked up in agenda planning when Mary's back.
Thank you. But it feels like a lot of what's been said today fits within their remit.
I think we talked about wanting a report specifically from St John's, didn't we?
And St John's.
Yeah.
Yes.
Not to give myself more work, but...
No, but we also don't want to be seen to be putting all our eggs in one basket, because we know there's a number of different bodies around that will be formed of partners that I think it's useful to hear from.
With the action plan, Paul's point added to it.
Yes. So is there anything else that we've spoken about that is not on the action plan and that we haven't mentioned just now? Kevin?
Only looking at the minutes, you did mention that for further updates there might be a cancer services update, something around the community hub funding, and also you mentioned your physicians' assistants and their role in GP practices. Whether that's a lead, whether that's an ICB update, some of those, as opposed to a paper.
Okay, what we'll do with that specific question, when you've turned your microphone off. we will pick that up with Laura, and so that can be part of her next update to us as well. Liz.
I think in previous meetings we've mentioned under 5's health study, homelessness health update. I don't know if we want to revisit dentistry update or, we've got so far with that, and I think we need the government to do something about it, perhaps. Change government there, excuse me. And refugee support update.
Yes, and within that refugee support, perhaps we could also have a specific piece around asylum-seeking children as well.
Yeah.
Yes. Okay. Anything else? Oh, the safety valve update, which doesn't appear to be on our report, on our work plan either. And then there was one more thing, which was, and I did make a note of it, I see that there is a new consultation that has just been launched today, which is on send home to school transport. I don't think you mentioned this in your report, Paul, so perhaps we could have an update on that. Did you mention that the consultation had started today? Okay, but I don't think you mentioned it in your report, so that was, we're just referring to that, and I think we would like to have that, come to... Okay.
Yeah, I think we're already, again, it'll come up at agenda planning, but I think we're planning for a report on the consultation and the policy to come to scrutiny in May. That's the timeline.
Thank you. Well, then we will make a note that it's on our agenda. Okay.
Sorry, Chair, but I think we did mention about Charlton House update and consultation with staff about redundancies, so we wanted an update on the report.
Yes, and of course, with Charlton House, yeah. It's very much a two-part. Yeah. Well, it's many more than two parts, but so there's that element which is adult social care, and so that part I think fits within that, and obviously that's our next scheduled meeting. But then I think that the one after that, in terms of how the piece of work is going around changes to some residential usage, I think would be also very of value to this panel.
I think with regards to the potential conversion of the site, the timeline, the actions needed, I think we can probably bring something in the same, possibly in the same report, the update for the next adult panel, rather than wait until children's. We can do that then. That's not a problem.
Well, anything else anybody wants to mention? Well, in that case then, I will close this meeting, and only a few minutes over what I thought we would, where we would be. So thank you very much for your attendance and your very useful questions. Thank you.